Welcome, everyone. Welcome to the final session in the Torrance Festival of Ideas. I'm delighted to see you here. We've had 3 previous sessions that were incredibly stimulating and very insightful on the power of creativity in the health sphere. The final panel is quite different from the others because it focuses on a topic that I think really doesn't get as much attention, which is how creativity is conceived of in the field of medicine and health practice in general. And I think we've got a wonderful lineup of speakers here to speak exactly to this topic. We have Richard Schaefer, Sujal Manohar, and Erica Kao, all going to be talking about this from each of their perspectives in terms of the kinds of studies they've done or in terms of their pedagogical views of how medical students should be trained. And then the panel discussion will be joined by Catherine Niles and Lana Smith, who will also present their work in this context, and we'll hope to have a lively discussion. Please, anytime you have questions or reflections, just post it in the chat window. We'll be happy to bring it to the attention of the speakers. So I'd like to start with our very first speaker, who is Erica Kao. Erica is based in Stanford University at the moment. She's a resident psychiatrist at San Mateo County Behavioral Health and Recovery Services, as well as a lecturer of music at Stanford University. Again, the start of a lot of interdisciplinarity you'll see on this panel. She's trained in psychology and ethnomusicology, and she's spent the past couple of years conducting fieldwork and organizing songwriting workshops with social service organizations in New York City. She's now, as said, based in the San Francisco Bay Area, and she continues this work in community mental health settings. She co-founded Humans in Harmony, a 501 arts nonprofit, which organizes collaborative art projects with community members. And her writing has appeared in several avenues, such as Synapses, a health humanities journal, and the Journal of Medical Humanities. We're absolutely thrilled to have Erica here to speak to us. And she's going to start us off on the topic of co-creation in the medical humanities. Thank you so much.
Got it. Got it. That's perfect.
So much.
Yeah, you're welcome.
Really lovely to be here with you all and to be thinking about medical humanities, thinking about education and pedagogy and how the arts infuse in this work. And so I'll be talking about co-creation in the medical humanities. This is also based on my work that I've done across the years. So it includes the most recent work that I've done as lecturer in music in the music department at Stanford, as well as what I'll start off here, which is some work I did with medical students and health professional students at Columbia University Medical Center in New York City. So this is a group that was a group with breast cancer. It was a breast cancer support group. And so we have patients there working with students, such as one of my classmates here, who was a medical student, and also students across various departments, public health, dental school, nursing schools, were all involved in one of these songwriting projects. And I'll just start off right from the beginning with one of the songs that was created to get a sense of what was going on, and then set the ground for some of the questions I've been asking and thinking about the arts in educational and community and clinical settings. All right, so let me switch to Spotify, where we have the songs kind of on as an album. And this is the one called Apple of My Eye. Just go ahead and start.
Year after year, our memory so crystal clear, and I know the ins and outs of this city. Oh, I want to show her colors and lights. Oh, I see her face light up, Lady Liberty. Oh my, she's the apple of my eye. New York is the people, from Coney to the Heights. It's messy and chaotic, yet beautifully melodic. There's something about this world that's fueling your fire.
That was Apple of My Eye. It was a collaboration between a medical student with a participant in the breast cancer support group at the Columbia University Medical Center. And what we did was we had the chapter of Humans in Harmony at the medical center pair with the palliative care center with the support group. And we worked with the social workers, who you'll see as well. You'll see a lot of people in this photo. The social workers, the participants in this breast cancer support group, as well as the students involved. And one of the questions that I've been wondering about in the arts and humanities in community settings is, what is the role, like how do the arts and how does music help us enhance like cultures of care? And this is a bit different from maybe a typical approach of how the arts have been conceived in not just medical education, but even in social settings, which is a focus on kind of developing empathy or developing humanism. Instead of just a focus on empathy, which is more of an individual trait characteristic, or something that is focused more on the health professional student rather than thinking about the context of care, I'm interested in how like arts and music can create kind of reciprocal relationships between people and take into account not just looking at arts and music from a classroom setting, but looking at it within the clinical space and the community space, as we see in this photo. Oftentimes we see that the arts or music are taught in a way that reflects what can be thought of as more traditional, maybe like Western views of what's called the presentational arts, which is, you'll see music in maybe more of a concert hall setting where there's a clear distinction between a participant and or there's a clear distinction between the performer and the audience member. For example, the concert hall with the stage and then the audience members with, sitting in the seats. Or in another example, in art museums, where it's a more passive view of viewing art with the art on the walls. And so I'm interested as well in the question of how do we engage what can be called the participatory arts, where there's more of everyone is engaged in creating or co-creating, such as this example of collaborative songwriting. And so how this worked is we had about 8 sessions where the students they would first meet with the participants in the breast cancer support group and really understand their stories, get a sense of who they were, go back and create songs based off that idea. And so that's where you got this Apple of My Eye song. It was based off one of the participants who really loved New York City and was talking about her experiences with her daughter and being in the city. And so the song was reimagined in a way and then shared back with the participant in the breast cancer support group. I also was doing some research alongside this project and trying to think about measures that could look at the relationship and the closeness of relationship that was happening. So that's where I used what's called the inclusion of the other in the self scale. This is a social psychology scale by Aaron et al. And it's in contrast to a scale that has been typically used in the medical humanities literature, which is a Jefferson scale of empathy. And that scale was really more about looking at the individual experience of, like, for example, I believe that empathy is important in healthcare. This scale is different in the sense that both the community member and the health professional student can engage in it. And it basically asks you to circle to what extent you feel close, to how close you feel to the other person. So almost like how much overlap there is between yourself and the other person. So you might circle this one for the most overlap, and then this one for some less overlap. So I kind of looked at this pre and post and found that there was a significant difference in terms of this scale in increased overlap between the other and the self before and after. I was also just doing more kind of ethnographic evaluations, did interviews with the participants, and found some of these themes that was highlighted, which draw off kind of the things that I was mentioning before, really having the interactions be in community settings rather than, say, the classroom setting, that there was a joint goal involved in this process of creating a song, that there is diverse collaboration in people from various backgrounds. You didn't have to have musical experience. You could maybe engage more in writing aspect or the musical aspect or more of the ideas aspect. And that there was an evaluation that involved an interpersonal measure rather than the focus on the individual measure. And so this was kind of the framework for an interpersonal approach that could be thought of and developed further as we engage in arts and humanities in these settings. And especially if you're thinking about like the participatory arts that involves community members and students in the creative process. So that brings me to a little bit more recently, where I actually just finished teaching a course which ended about 2 weeks ago at Stanford in the music department. The course is called Music in Psychic and Social Life, and it involved students from, it's kind of cross-listed in music, anthropology, theater and performance studies, and psychiatry, undergraduates and undergrad and grad students who partnered with the Canyon Oaks Youth Center of San Mateo County, which is part of the county system where I work as a resident psychiatrist. And I was really drawing as a focus of the course the concept of co-creation, which is a really key concept in Paulo Freire's pedagogy of the oppressed, which I'm sure many of you are familiar with in terms of the pedagogical approach in education, as opposed to this like banking model of education where the teacher is almost like filling or just passively giving knowledge or information with this expert versus like learner. We have more of a co-creative process of co-creative education where there's like co-learning between the teacher and the student. And you can see the parallels between that and the participatory arts, participatory music approach, where you have like co-creation or people who were all participants in the creative or musical process. And so that was extended as well in Augusto Boal's Theater of the Press, where you applied that concept of co-creation to theater, and was something that we used as well in the course and in our songwriting workshops, in integrating some like improv and theater exercises that blur the hierarchies of power right from the beginning when students go into like this kind of community space with the youth center. And Canyon Oaks Youth Center is a youth center that's a residential treatment facility, like a group home, but also mental health facility that cares for teens who are about age 13 to 19. And so the students with the Canyon Oaks Youth, they met for about 10 sessions over this course weekly for about an hour in the workshop. And the first sessions started off as brainstorming ideas, brainstorming themes, and going to lyrics, then going into writing melody, adding beats and instrumentals, and then a recording sessions and a final song sharing celebration, where they shared the songs with everyone, including the staff. And the album was just released about a week ago on Spotify with permission of all the participants. So I'll play another song just from this iteration that just happened. Pass the Beat was the name inspired by an improv exercise, which is pass the clap, which is a theater exercise in which you like pass a clap around the room. And that just started off many of the sessions in a really just filled with laughter and everyone engaging with each other.
I woke up thanking God that I lived another day. I woke up asking God, please don't never go away. Stay up asking God, should I stay another day? Am I being selfish, trying to hide my own pain? I try to mask the pain, but it never goes away. I try to hide it from people that ask me if I'm okay. I try to hide the tears that keep falling from my face. I smile, and I thank God for letting me live another day. That's my freedom and faith. Thank you, Mama, for showing me the way.
That was Freedom and Faith. That was created with one of the youth and then about two of the students. So the groups were placed into groups about 3 or 4 each, and there was usually about 1 or 2 youth in each group. And the process for example, in this song was that the youth participant had really conceived, she'd already had a clear idea and was a poet. And so she wrote those lyrics and had them ready pretty quickly. And was almost like the director in thinking of how it could be brought into music with one of the students who is a guitarist. So you heard a guitar there. And another student who's a violist. And so brought her viola and added that viola part. And then I was recruited as a very last minute piano, just like very basic chords in there at the end. And then we had a recording session where it really all came together. We played it live and it was recorded and then performed at the very last song sharing celebration. The song sharing celebration itself was pretty remarkable because we had each of the groups of these 4 songs go and kind of share their process of how the song was created, share it with many of the staff who included kind of therapists that the youth knew pretty closely who were there as well. And although the groups were kind of hesitant initially to share, a little bit like bashful, by the end, they were all so excited that they wanted the songs to be played just like again and again. And so we ended up having the songs just on loop throughout all of the celebration, which included food. And yeah, just was really community building exercise and experience for everyone. And so one of the things that I've been thinking about, because I've done various iterations now of the collaborative songwriting project. The first iteration actually started when I was interning as a college student with a nonprofit called Join In Voices in Boston, which worked with teens in detention centers. And it was pairing these teens in detention centers with kids with cancer as part of the Ronald McDonald House Foundation. And they had written songs the teens in detention had written songs based off the experience of the children with cancer. And so it was almost like an imaginative exercise in empathy or pro-social behavior that I was interested in focusing on as that element of research. And that started to evolve into thinking about empathy development in a medical and clinical context once I started entering kind of clinical practice, which then evolved into thinking more about rather that individual measure, really thinking about the interpersonal aspects of the relationships that are happening. And so I think of these exercises or these workshops, which also included then Humans in Harmony being co-founded in New York City and doing more extensive research and workshops with about 5 different social service organizations in New York City. We worked with like Isabella Geriatric Center, nursing home facility. We worked with teens or at-risk youth who are experiencing homelessness. And we also worked with adults with disabilities in an adult day program, brought them even all together with each other. And actually I can pull this up because there's if you look on Spotify with Humans in Harmony, we have a whole album, like The Journey of Love, and that includes a lot of these other organizations as well that we worked with. And the trend that's happened is that we've started to think about it as a more collaborative, co-creative process. So you'll see from the first song that we heard, which was Apple of My Eye, it's different from the more recent workshop that we did in the sense that the students met with the breast cancer support group patients in an initial session together, but then kind of worked on the song to imagine that song and what kind of tell the story through a song and then share it back with them. Whereas in our most recent iteration, it was really like collaborative through each of the sessions where they were creating the songs and doing it in real life time together. And so that's where we can start to think a little bit more about maybe co-creation being on a spectrum, and elements of having more co-creation, having more of that participatory element involved. So I'm thinking about the next steps, and here we go. Okay. One of the next steps is thinking about participatory action research. One, and whether participatory arts like music and collaborative songwriting can be engaged as part of this process. So there's a methodology called photo voice that has been used in public health settings, which uses photography as a methodology of what's called participatory action research or community-based participatory research methods, where the community members themselves are given cameras and can photograph their community and then bring back these photos into the group setting and determine what are the themes, what are the issues that they might like to address with researchers and with each other in addressing whatever community needs, which then might be something like a policy report, or it could be a presentation of the photography. But what's really cool about this is that it engages the participants as well in the methodology and research process. And so the next thing that I've been thinking about is whether we can use sound or music as part of this process. And maybe for the next iteration, incorporate participants using sounds in their communities and doing something like a big group song that highlights the themes of or sounds that they found. And that's something that I've been thinking a little bit more about. And I think it, along with co-creation as a concept, I like to think of feminist scholar Nancy Fraser's work on affirmative versus transformative remedies. And so the idea of transformative remedies as really like disrupting the structure, the power relations, and affirmative ones maybe sometimes reinforcing those relations of power that exist, especially when you have something like health professionals with patients, for example. And I think that as we move along more toward the co-creative or the transformative sides, we also move towards the participatory ways of engaging in both like arts or music and in research methodology. So thank you all so much. I'm really glad to chat more and also take some questions. This has been a really, I guess, also a collaborative process with researchers like at Stanford, with the co-instructor Elizabeth Schumann, with the staff and participants at Canyon Oaks Youth Center, and also ongoing collaborations with Humans in Harmony, the nonprofit team, and the students and community members at the Columbia University Medical Center and the community-based partners. So thank you all so much. And I see we have a question.
Yes, thank you so much, Erica. That's for a wonderful presentation and for this completely, let's say, interdisciplinary approach, really. Do you see a question in there?
I think from Richard.
Yeah,
Hi.
Richard's raising his hand.
Oh,
Yeah,
yes, Richard, please unmute and
Yeah, thank you, Erica. Wonderful talk, wonderful work. Teens in detention, writing songs about teens with cancer. I mean, that's incredible. Just the sound of it, much less doing that. Congratulations. The question I had was, the groups are brought together for the purpose of creating a song. Did you see any maybe positive side effects of human connection outside of the song? Maybe I guess I'm thinking like participants. Oh, hey, let's go for coffee afterwards, or they they find out they have a common interest in something else, and or become friends, or other ways.
I think the initial thing that comes to mind, especially from the recent Canyon Oaks Youth Center partnership, is that although I don't see the youth outside of their, we only kind of see them in the music setting context, but I could tell that there is so much just kind of friendship that seemed like it was being built, because by the end in the song sharing session, they were taking photos with each other, taking photos. Um, and so there was like that aspect where it just felt like learning about each other, deepening that kind of connection. From the student end, because I kind of am, we have transport that's arranged. So what I started to see as the course went on is that the students would tend to like want to be with certain people and in going back in cars, like when they're groups together. So that was something that you could see kind of outside of the music workshop space itself, but it was even kind of being seen in the transport part of who was going in whose cars, those aspects.
That's great. Thank you.
great. I think we have a question from Catherine. Catherine, would you want to ask that directly?
Yeah, for sure. I was just curious if any of the students ever came back to hear the new songs that the new classes did.
Oh, you're if any of the students,
Like if
came-
anyone came back to see the new songs that were made by new students.
oh, I see, like through the various iterations, if
Yeah.
if there were others who were coming. Yeah, so the this is the first time it was done here in California in Stanford, and the other ones are actually done in New York City. And so at least for this one, this is new. Although, I think it'd be so cool as we're thinking about doing another iteration to almost have this community, right, of people who've engaged in this and can continue. But definitely when I was in New York City, we actually had a chapter like at the med school of Humans in Harmony, the nonprofit that kind of coordinated the workshops. And so you would have the same people engaging again, or at least going, being involved, maybe not directly as another participant, but like in the recording session, for example, like joining and helping with the recording process, or helping with adding an instrument or something like that. And so we saw that kind of community being built.
That's very cool. I have perhaps a related question. Is there any it's kind of related to the kind of questions we've had in the past session as well, which is on the barriers of acceptance on the student side of these types of new practices. Really, it's not what I imagine they're trained through medical school for. So can you take us a little bit through the sort of what it takes for the students to find the importance in sort of alternative pathways to engaging with patients and clients in general? If you could speak to that a little bit.
Yeah. Yeah, I have to say that as a medical student who loved the humanities, I was really excited to engage in these like humanities curricula we had. But that once I did, there was a lot of skepticism, I mean, from my classmates and even from my experience of it, because it would be us like reading a poem and just like it just didn't seem like there was enough depth to it, almost like we wanted it more, because you just have maybe some like a preceptor who isn't trained in deep reading or close reading, and then we're just kind of reflecting, and at times it could feel like frustrating. And not only that, when it was centered around developing our own empathy or humanism, it felt like that also wasn't rewarding, because the issue wasn't necessarily humanism development or empathy development, but we felt more of systems of care like burnout or those impacts.
Yeah.
And so I think that this kind of thing is different. Well, one, because it wasn't formalized in the curriculum itself as a medical curriculum. It was more of an extracurricular that they were doing. So everyone was engaged in volunteering to do it. But they also felt like it was different from the typical curricula, and that they're really working with the patients and working in the community space rather than classroom space. And that they actually got to deepen relationships with patients in ways that they didn't in the clinical space, which is very rewarding. And so I think there was a bit of a different take almost than more traditional curricula that's more like required or has a certain framework about it.
Yes, that's a great point, because I've always wondered what, there's a lot of sort of positive reinforcement for doing things that go outside, right? Like you should do it only if you get research credit for it, or some kind of, the sort of credit system. And what that does to a kind of intrinsic motivation, if you want, or the development of skills for where the reinforcement actually quite internal. Like this is good because it expands your own perspective, not because you get an A on it or it gets on your CV, and so on. And I imagine certain disciplines are much more focused on the carrot and the stick kind of approach than others. I see a raised hand here. I'll get to yours as well, Desi. Thank you. So I was wondering if, I think if you have training models, and correct me if I'm wrong, in the medical curriculum in general, which are so focused on the sort of show and tell kinds of ways of thinking about how to qualify oneself and put oneself above the rest. Is there really any space, except for the few who happen to be curious? I mean, I agree. I think it's actually really important for it to be outside the curriculum because it engenders a certain kind of interest, but it then leaves out a lot of people who wouldn't normally do it. But can you think of some ways in which perhaps research that you're familiar with, where this expansiveness is allowed in a more, the curriculums have been developed to allow for a more expansive kind of educational kind of focus to come in?
I guess just from the bat, I would say I would love to see medical humanities really incorporate this more into the curriculum. And I think that's the bent I'm trying to advocate for here, is like, let's have this into the curriculum, because it's so much meaningful when we can engage in arts and humanities in the clinical space with the patients and not just separate like in the classroom, where it feels so much more rewarding and more maybe intrinsically motivated to why we went into medicine, which is to help like patients and really get to connect and know the patients, which the healthcare system just doesn't allow that kind of space and creativity for. And the training process as well. I think maybe as a project of, I guess you see a lot of the restrictions of the healthcare system in really dictating your schedule, dictating how you do the work, which is not a lot of focus on having a lot of time to connect with patients. The process that we go through as medical students is very regimented and checking boxes or jumping through hoops. And so as much that we can incorporate more of maybe that human aspect and connection part, I think that will resonate with students, and to incorporate that into the curriculum. So I don't know if that, answers the question, but maybe one take on it.
Yeah, absolutely. Thank you so much. That was really an insightful comment there. Desi, I will add you to ask your question directly.
Hi, Erica. Thank you so much for sharing your work. It's really lovely and yeah, it's very inspiring. And in the last session, we had addressed empathy a little bit because it does seem to be at the core of kind of what the arts or other creative activities can do for community health. And then I really love that you kind of immediately addressed that, but said, but actually the humanism component, as you referenced, again, is sort of the quality that is really essential to the way humanities and medicine interplay. And it's making me wonder, like, there's sort of this idea I have of the history of medicine where, like, wasn't it human first? Like, so human first. It's almost like there's been this walking away from that. And now we're like kind of trying to rein it back to that. So where, someone who, like someone who works with you sees you grow and change and understands your trajectory, or even within an acute situation, the patient is a person, not just a patient. So I kind of wanted to hear more about maybe your own thoughts on your experience of that it sort of seems like we're relearning this way to heal each other.
Yes, I think that from, I guess, my experience of the development of the healthcare system, and maybe one of the shocking parts from my experience of when I entered kind of the clinical space, was kind of the lack of time that we did have, despite the focus on humanism and development of empathy as medical students, to not really be able to do that in the clinical setting. And like you said, there's a big shift with the healthcare system being more specialized, where where you don't really have that longitudinal care and knowing in the way that, say, when you were a doctor who was really known in your county or place or village of practice. That's very different than how we practice medicine now. And so I think it's so important, like you're saying, like the humanism aspect. And at the same time, the way that it's being focused on is almost counterintuitive because of the system and the development. And because the issue is more problems of burnout, problems of limits on your time, of electronic health record system, and focusing on the computer more than the patient. All of these are more the issue than the like development of empathy per se, in trainees. And so that's where the idea that, hey, what if we can shift the medical humanities to really incorporate those structural social determinants, like what's happening in the system, and thinking about the culture and the relationships rather than the individual.
Thank you for that. The question, Desi and Erica. I have maybe one final question. If anyone has raised hands, please someone alert me to that. I can't see anyone there, but it gives me a chance to answer another question I have, and because you have this unique kind of position, because you're a psychiatrist and you're in the College of Music, and I'm wondering how these are two very different traditions. Both have a very applied focus as well, of course. But can you tell us a little bit about how one practice for you informs the other and vice versa? That would be useful to know about in terms of, in praise or not of interdisciplinarity.
Yeah, yeah, thanks for that. I'm always feel like I'm in the space in between or like thinking, one way when I'm in other space. And sometimes that can be like difficult, but at the same time, yeah, in praise of interdisciplinarity, I think it adds and lends a lot of perspective and also new approaches. And so one of the examples is as a psychiatrist, I integrate I do organize, for example, music groups on the unit, sometimes when I'm in the inpatient unit, for example, and there are inpatient like groups, and I'll organize something like a music group and do it with the patient. But I think also on a more practical, more like individual level, I've become very interested in psychoanalysis, and psychoanalysis as being quite interdisciplinary in theory, um, across critical theory, English, and then psychiatry, and so I find that in academic spaces as well, and thinking about psychoanalysis in the arts, then I'm drawing in my own clinical practice in that way. And then also in practice, maybe in a therapy session, I'll be integrating some of the theories I'm thinking about, including in the relationship that I'm talking about here, like co-creative relationship. You have that co-creative process that happens in a relationship with another person, from say with the client or your patient that you're seeing, and how I interact. And so I'm very aware of those boundaries of power in a clinical setting. And it also informs, how I think in a more theoretical way. So really it's lovely because I think the importance of the theory and practice is then you have the praxis and you really can integrate those two.
That's great. Thank you so much for that. I have a question from Elizabeth Peterson Jennings. Do you want to unmute yourself and ask the question, Elizabeth?
Hey, everybody. That was incredible, Erica. This whole convening is really inspiring. And I guess I wanted to make a comment and sort of a question. This is the third sort of convening like this that I've been to in 2 months. I think it's very finger on the pulse. And as somebody in museums, I feel a little shy to wade into conversations with someone who's a clinician or a medical student. But I think it's very important because we're moving away from that just social model to a more medical models, and it's both are valid and they need to shore each other up. So one thing I was curious if you knew about the program they're doing at University of Virginia School of Medicine in the Fralin Museum. They have something really well established called the clinician's eye, and so it's in part about burnout around medical students, and a real connection, and it's very well established. So there was that. And then my question is to ask you, how do you think those of us who are working in the arts area can best connect to that more clinical? I've got two things that come to mind in the Atlanta area. One is Heartbound Ministries, which does all kinds of things from chaplaincy to apiaries, but they also work with, incarcerated populations and art. And then the other one is called Chop Art, that was actually started by an Oglethorpe University, that's where I am, an Oglethorpe University alumna, to specifically connect to unhoused youth. The founder herself was unhoused when she started college, and do that through the arts. But again, it's been the social model. So there are these things that exist, and then how do they catch up to what's happening now that we're, very important data collection is happening, and so it's a comment and a question. Thank you very much.
Thanks so much. It's really cool to thank you for sharing about the clinician's eye and then all these other programs as well. It's really wonderful that you're thinking about this from the art like museum space and really getting involved into that clinical space. And I think I guess maybe currently it is hard to know the formal like structures of how to go about doing that. I would say the ways that you're engaging be through like community-based organizations, or for example, Humans in Harmony is trying to, as a nonprofit, connect students or artists with these more clinical settings and having that. And so that's the space that I see this work happening in, which is great because it does feel like a more almost like civil society way in which it's being engaged in. At the same time, it's not as much formalized. For example, if medical humanities curricula could really integrate more artists in the community with medical students as well, and really have that as a framework, I think that could be one area that would create another avenue to go about doing this. And
Yeah.
yeah, yeah, I think that an ideal world we would also maybe see more of the academic community and medicine partnerships. I know that there's kind of like Project Zero at Harvard that really does that with education, but if we could have some kind of hub or center that could do that with medicine and the arts more as well, that could be something that would be aspirational and really good to see.
Thank you so much, Erica. All of you, please, if there are any more questions, please put it to the chat window. We'll get to it in the panel. Thank you so much, Erica. I'm going to jump straight on to the next speaker, who is Sujal Manohar. She is going to try sharing her screen with us. Or are you having any difficulties there? Is that okay?
Yes, I can go ahead and share. I've just been
Cool.
having a little bit of technical issues with my computer, so I just shared the link with you guys in case I get kicked off of this and I can rejoin on my phone.
Okay, thank you so much. So I'm just going to introduce Sujal to you. You can try and share your slides in the meantime. So Sujal Manohar is a visual artist and a medical student. She thrives at the intersection of medicine and the arts. She's at Baylor College of Medicine, or soon not to be any longer, but she can tell us about that. Her work includes leading art gallery tours for adults with dementia, incorporating the arts into health professionals' curricula, and creating an art and storytelling program for older adults and medical students. She graduated summa cum laude from Duke University with degrees in neuroscience and visual arts, and she's just finishing up at Baylor College of Medicine, I think, and she is preparing to start a neurology residency in summer 25. And is that at UPenn? Did I get that right? Yes, wonderful. Okay, thank you so much for joining us, Sujal. I'm really found your articles so interesting, the ones that you published, and looking at arts-based practices across both patients and practitioners. I'm so excited to hear you speak on this. So thank you so much.
Awesome, thank you. Really excited to be here. I'm Sujal. I'm a fourth-year medical student at Baylor, and like mentioned, we'll be starting neurology residency this summer. And I'm excited to share a little more about how the arts and humanities can benefit health professions, learners, and providers. So, brief learning objectives for my talk. I'm going to highlight how the arts can benefit medical training and education, and also explain how the arts can be a tool for advocacy and also provider and trainee reflection. And I think this talk is going to complement Erica's talk really nicely, and hopefully the others in this session as well. Thinking about it a little more from a visual arts perspective. So a little bit about me. As you can see, I'm a lifelong visual artist. I've been doing drawing and painting for pretty much my whole life, and I have always really enjoyed it, whether it be, collaborative artwork, drawing or painting by myself, teaching others, has been a really consistent interest of mine for a very long time. And more recently, I've been able to think about how that art interest also fits in with my interest in science and medicine, and really work to bring those two fields together. So just a little bit of my background, a little bit was mentioned already, but I grew up, doing drawing and painting. I double majored in neuroscience and visual arts at Duke, where I discovered a lot of really interesting interdisciplinary activities, such as teaching art to patients or leading art gallery tours for folks with dementia. I then spent my year after Duke teaching art to adults with intellectual disabilities through the AmeriCorps program. Almost done with medical school at Baylor. I'm excited to start neurology residency. at UPenn this summer, but really thinking about how to weave together these interests. I don't want to just necessarily view art as a hobby and be a doctor, but to really integrate these two fields together. And this is a little logo that I made that I think highlights my goals in that space, like a little brain and art palette put together. So I have my talk in kind of two different sections. The first one is going to be focused more on training. So talking about how the arts and humanities can help train better health professions, learners, and providers. And then the second part is going to be focused more on art as a tool for advocacy and for provider, raising awareness about patient and provider perspectives, and how that can also be a really valuable tool for providers processing their experiences with different patients and other challenges along their journey. I'm going to start off with the first piece about training and education. And I want to start off by sharing about the FRAME report. Would love to hear from anyone in the chat if you're familiar with this report, but stands for the fundamental role of the arts and humanities in medical education. And this is a landmark report. It was published by the AAMC, or Association of American Medical Colleges, in 2020. And it was really the first time that any sort of landmark report like this was published looking specifically at the arts and humanities. So it really signals a big culture shift coming from organizations at the very top that are overseeing every medical school in the country. Survey data mentioned in this report from 2018 showed that about 70% of schools in the AAMC offered some required humanities courses, and about 80% had some sort of humanities elective. So I'm suspecting that number has gone up quite a bit since that survey was done. But this report is really great in highlighting the various existing programming in the arts and humanities as it relates to medical education, but also highlights the literature gaps. So for example, there's really not been a lot done with pre-health students and different areas like that. So I definitely encourage you to check out this report if it's of interest to you. Coming out of the FRAME report about a year later, authors published the PRISM model. And this was basically a model that came out of a large scoping review looking at various arts and humanities programs that were in different medical curricula across the country, across the world. And looking through all of those different programs, they found that arts and humanities activities were typically serving 4 key functions in medical education. So those functions were mastering skills. So think about wanting to improve, get better at something like communication, for example. They could also be focused on perspective taking, so helping learners understand more about the perspectives or situations of others. Personal insight, so giving learners more of an understanding of their own biases or their own perspectives. And then social advocacy, so raising awareness of issues such as health inequities. And then with a team of folks at Hopkins and other institutions, I worked on a paper that kind of has a step-by-step approach of the PRISM model. So the model is kind of very theoretical, doesn't have as many examples in it. And so this paper has like a step-by-step curriculum walking through how to design something, keeping the principles of the PRISM model in mind. So it could also be a helpful resource. But I think it's really exciting just to see how much literature is coming out in this space. It's very much a growing area, and there's more and more programs and more ways to evaluate them. So I want to caveat this by, saying these are some of the potential benefits of art observation, but that's certainly not the only arts and humanities activity that could be implemented in a medical or health professions curricula. So I know Erica was mentioning a lot of music or photography, all sorts of things. But when we think about arts and humanities, that could include visual arts, music, dance, theater performance, creative writing, photography. The list could go on and on. But in my talk, I'll be focusing a little bit more on art observation, but there's definitely evidence showing the benefits of all of those other modalities as well. But when thinking about art observation, specifically for medical learners, there have been several studies coming out that show benefits for things like mindful attention, self-reflection, empathic communication, perspective taking, and even clinical observation and description. I think this is really exciting because a lot of those skills, if you look at them, are really, really hard to teach in like a typical lecture. So you can't just give someone a lecture on like how to communicate with empathy. Like that's something that's a lot harder to learn quickly and might take a lot more experience or different interactions to really practice. So I think that's a real strength of some of the arts and humanities programs in medical curricula, is that they can try to teach some of these skills that are very important for clinical competency, but might be a little harder to teach in a typical format. And within the realm of art observation, I want to highlight an activity called visual thinking strategies. So this is an evidence-based method developed by Philip Yenawine and Abigail Hewson, which encourages open discussions of visual art through a very structured format. So if you were doing a VTS session with this art piece here, for example, you would be working with a facilitator who is trained in VTS. And after taking a moment just to look at the piece and observe silently, the facilitator would guide the group through these 3 questions. So the first is, what's going on in this picture? What do you see that makes you say that? And what more can we find? And so this is kind of a reiterative process. So one person might answer, they might say, oh, the woman in this photo looks sad. And then the facilitator would ask, what do you see that makes you say that? And you might say, oh, her body language and her facial expression. And then with the third question of what more can we find, we would solicit more and more opinions from different people in the group. My favorite thing about VTS is that you often hear very different perspectives and interpretations of the same art piece. And what's important as well is that it really doesn't matter what the original artist had intended. It's not about getting the right answer or, learning about this art history information. You're learning from the art. You're not really learning about the art. And that makes this activity very accessible for people that really don't have as much of an art or art history background. And so after going through a session like this, the facilitator would be summarizing after every comment and then trying to link comments together. And at the end, there would be a debrief session as well. As you might imagine, this whole process can foster clinically relevant skills. It's kind of similar to looking at a patient. You're trying to understand what's going on, what the diagnosis might be, or what could be causing a certain symptom. And then you're trying to back up that claim with evidence, whether it be something you're seeing in the patient, something they tell you, something on imaging, and you're trying to piece those things together. And so that kind of reiterative process of asking questions, trying to back it up with evidence, and then searching for more can be very similar to that clinical patient observation process as well. So this is another slide highlighting the VTS process, going through those 3 questions I mentioned, and then thinking about the transfer to clinic. So there's evidence showing that VTS can build clinically relevant skills like observation, communication, and tolerance for ambiguity. I think radiology image is a very easy example to think about, the importance of visual observation and making sure that you're not, fixating on one piece of the image and then forgetting about the whole picture, for example. And I think VTS is always a great activity that shows you that there's more than one way of looking at the same thing. And sometimes when somebody else will point out maybe a detail in the art piece or a different view of the image, you can't unsee that. You always have it in the back of your mind. And so thinking about VTS, there have been a lot of courses, specifically many of which have been done through Johns Hopkins, utilizing museum-based education in health professions learning. And museum-based education is a broader topic, so that includes activities like visual thinking strategies, but can also include other activities in the context of an art museum. But Johns Hopkins has been doing these types of courses for about 5 years. And so I worked with a team of folks, some of which were students, to do a retrospective piece that really looked at the trends from several years of these courses and to see what key takeaways could help others interested in these types of programs. And so this is a brief overview just of the programs ranging from 2019 all the way to 2024. You can also see the number of sessions that were offered, how long each session was, so usually 2 to 3 hours, whether it was a 4-credit course or more of a research study. And then, of course, with COVID, to consider the format, in person, online, or hybrid. And then thinking about who was participating. So whether that be pre-health students, preclinical medical students, or clinical level medical students. And then thinking about total number of participants and evaluation methods. So I'll be going through some of the key takeaways that we found after looking through the evaluation material for each of these courses. There were different things done, whether it be pre and post surveys, reflective essays, focus groups. So really trying to look at these different types of courses, what was working well and what was not. So I'm going to start off thinking about the learner background. So who takes these types of courses? I think this can be really helpful to consider if you're trying to design, whether it be a museum-based activity or some other type of arts and humanities activity in your own institution. We found that some learners had considerable prior experience with the arts and humanities. I know I would fall into that bucket. I would naturally be interested in taking these types of courses, but there were also a good number of students that chose these courses because of their novelty. It seemed like something interesting and different, seemed like a break from the typical medical school classes, perhaps. And so there were students that really came from a range of backgrounds. And I think the takeaway here is that when you're designing these types of activities, it's important to emphasize that no prior art background or experience is required. In terms of learner stage, based on our retrospective, we found that there were similar benefits from the programs across pre-health, preclinical, or clinical medical students. And importantly, it might be helpful to have these types of activities incorporating the arts and humanities at periods of transition. So thinking about, starting medical school, maybe going from preclinical to clinical medical school, transitioning to residency, all of those transition periods, not surprisingly, are associated with increased feelings of anxiety, stress, or feelings of inadequacy. And so this might be a particularly valuable time to incorporate activities like this. Thinking about course size, generally, prior studies on this have shown that groups of 8 to 12 students are ideal for generating good discussion, still involving everyone in the conversation and having a variety of perspectives. And similarly, based on our retrospective, we found that about 4 to 10 students has been ideal for these types of discussions. And then thinking about the format of these courses being virtual, in person, or hybrid. So I will clarify to say that hybrid does not mean that some folks are in person and some folks are online. It means that the actual class has sessions that are either entirely in person or entirely virtual. But folks who participated in a entirely virtual course, the vast majority seem to prefer hybrid. But then those in a hybrid course preferred in person. So I think it just goes to show that there's a lot of variety here. There's certainly benefits that we found in student comments, benefits of all of these models, increased accessibility with virtual. Of course, it's hard to fully replicate a museum environment unless you're in person. And then hybrid can have some of the benefits of both. So we really encourage folks to consider their own local resources, what partnerships might exist at your own institution, and also the learner's experience. And then thinking about activities like the visual thinking strategies or VTS that I described, or other activities that you could do in a museum-based setting, educators can be very intentional about articulating their connection to clinical work or professional journeys during a debrief session of VTS, for example, or debrief sessions embedded throughout the course. And there's also evidence that shows that participating in these types of museum-based activities can have objective clinical measures that might be improved after participating. And so there have been some studies showing an improvement in visual observation skills of radiographic imaging and retinal pathology images. So that's a very direct clinical correlation. And thinking about the value of reflection in these courses was a big takeaway for us. We found that students consistently selected that reflection was one of their favorite parts of these courses. it really gave them time to think about their own journeys, think about their perspective as a medical student, maybe reflect on their experiences with patients. And reflection has been found to promote wellness and professional identity formation. And we found that in these courses, having embedded formative intentional reflection, so having it be a part of the course throughout the entire course, was the most valuable for students. And so this was allowed them to kind of capture their thoughts along the way and not just have one opportunity for reflection right at the end where they might have forgotten things from earlier on. And then I also want to touch on here at the end the importance of evaluating museum-based courses and more broadly any arts and humanities offering that you might be exploring. There's a need for more and more research on these types of programs, and it's impossible unless we actually evaluate them somehow. And so some of them might be exempt from IRB approval, but some of them might need your institutional approval for that. But what we've seen both quantitative and qualitative research approaches, whether it be surveys, focus groups, analyses of reflections, and it's also could be helpful to consider more validated psychometric scales here as well. But students, importantly, reported benefits from both one-time and longitudinal offerings here. So I think this is really exciting. It shows that you might not need to develop a whole course or program around something like this. It could be a one-time activity, and that could still be valuable for students. And then lastly, a big takeaway here is about faculty development. So we really need more faculty support and training to start and sustain these types of museum-based programs in health profession schools. And the Frame report, which I mentioned earlier, really highlights the value of providing more professional development for faculty. I want to share one example here through the Harvard Macy Institute. This is an art museum-based health professions education fellowship. I've heard lots of great things about it. I cannot participate yet, but it's for faculty and to really learn more about museum-based education, visual thinking strategies, all of these topics, and think about how you might want to incorporate them at your own institutions. This is a great place to start. All right, so I'm going to switch gears a little bit and talk about, now that we've thought about how arts and humanities activities can help train and be valuable for health professions learners and providers, I want to think a little bit more about raising awareness, advocating, and how that can also be beneficial for providers. So I want to start off by sharing what got me interested in art as advocacy. So as I mentioned, I spent a year teaching art to folks with intellectual disabilities at the Imagine Art nonprofit during my gap year. And this largely consisted of art instruction as well as individual mentoring. Unfortunately, you can see this was during COVID, so about half my year was online, and then we did have some in-person time as well. But my time at Imagine Art and really hearing directly from some of these folks gave me insight into some of the systemic challenges that folks with disabilities face in many aspects of their life, and really motivated me to better understand their perspectives and also raise awareness about them. And so it was during this gap year that I started taking stories from the artists and transforming them into art and writing. So this piece on the left is called No Access, and it was inspired by one of the artists I worked with who was trying to come into the studio for the first time in person. And she got off the bus and just could not make it to the art studio because the sidewalks were missing and there were all these cracks and potholes. And she ended up having to use her wheelchair and come onto the road, which was really dangerous for her. But really highlighted how inaccessible just a short walk was for her, and motivated me to create this piece as well as a few other writing pieces about sidewalk accessibility for folks with disabilities. Then when I got to medical school, I was thinking a little more about patient stories and experiences. And I channeled a lot of the patient stories I was seeing and hearing into art pieces. Of course, this was aiming to advocate for the patient and their condition and raise awareness about that. But at the same time, it was also really beneficial to me as an avenue for my own personal reflection and really documenting my experiences in a more creative way. So I'll share one example here. This is a drawing I made from a patient who described their genetic condition as the cards they were dealt. And that phrase really stuck with me, and their whole perspective on their genetic condition was really striking. And so I created this art piece with like a hand of playing cards with these different genes that are involved in common genetic conditions. And I think it was very insightful to kind of hear that from the patient, and then very rewarding to translate that into something creative, both as a way of kind of commemorating the patient's story, but also giving me an avenue for processing and appreciating that patient's perspective. Similarly, I continued this type of work. This was during my pediatric neurology critical care rotation, which you might imagine was very emotionally, a very emotional rotation at times. And what I noticed in the ICU is that emotions would often blend together. And so I created this piece with kind of no real boundaries between the words, the drawings, the designs, and there were kind of hearts and broken hearts and tears and kind of all these different emotions swirling together with some of the phrases that I was hearing in the ICU. And again, I think this was a valuable way to raise awareness and advocate about the experiences of some of these patients and families, but also really valuable for me to kind of commemorate some of the patients and families that I was working with, and in a way felt like their stories could live on in a more creative way. And I'll share this last example. This was from a student who detailed the positive impact of medication on her depression. And so I have these different like prescription bottles with words like hope and love, showing these different flowers, and then showing how something like isolation can be really damaging for mental health as well. So finding different creative ways to highlight patient stories, I think, has been a really valuable part of my medical school experience, and something that I hope to continue on throughout my training. But it's been a real privilege to hear from patient stories and kind of take the message from what they're experiencing and depict it in a more creative form. So now that I've touched a little bit on the advocacy piece, I'm going to share in the last few minutes here about a program that I started that kind of incorporates elements of both of these areas. And so this is the Draw Your Story program, and I'll share a little bit more about that here. So this program really was started by myself and another medical student using art to address social isolation. So to set the scene for you, this is 2022. We're just coming out of COVID. People were vaccinated, but COVID had limited a lot of activities at senior care facilities, and of course, social isolation and loneliness were very common. At the same time, there's been a lot of research showing that intergenerational arts and humanities programs have shown success in addressing social isolation and bringing together younger students with older adults. There's also evidence that shows it can help health profession students better understand aging populations. And I think while we're thinking about the social isolation and loneliness of the older adults at these types of senior care facilities, students at this time were also very, very eager for in-person opportunities. Everyone wanted to go out into the community, meet people again. Nobody wanted to do Zoom volunteering. So there's a real interest from the student side as well to get involved in the community. And so with myself and another student, we started the Draw Your Story program at St. Dominic Village, which is a senior care community near my medical school in Houston. And we had funding from the Albert Schweitzer Fellowship, which supports graduate student community projects. And the goal was really to reduce social isolation amongst older adults, to foster intergenerational connections, and then to increase medical student comfort with older adults outside of a strictly clinical setting. So you can see this is kind of how the program looked. We would have weekly sessions every morning where we would share stories around a certain topic. So it would be a different theme every week. Maybe it was Thanksgiving or the holidays or, favorite foods. And folks would share stories, and they would also create an art piece representing some aspect of their story. And so we had about 20 residents involved and about 24 student volunteers over the course of a year. This is one example of some of the drawings that folks created during one of the Draw Your Story sessions. The theme here was home. And so you can see people drew their childhood home, they drew like moving around different places. And these are some of the prompts that started the conversation. So like, what does home mean to you? What made your childhood home special? And how did you feel when you had to move from one home to another? And so really insightful discussions. And one of the things I loved about Draw Your Story is just how much the younger medical students would have in common with some of the folks at St. Dominic Village, and how there are a lot of common themes throughout their lives. For example, one of the medical students highlighted how much she didn't like moving around growing up. And similarly, older adults had some common experiences there, especially highlighting the challenges of moving to a new facility in older age when they were no longer able to live on their own. So we had an end of year exhibition for the program as well. And so you can see we displayed all the drawings together from the different sessions, and you can't really tell whose drawing is what. You know, did a student make this? Did the older adults make this? It was all kind of displayed together in a very community setting. And we had an art exhibition where folks could come by and see their work. And it's really nice to just watch people take pride in their work and really mingle intergenerationally. And I like to think that this program, you know, had benefits for everybody involved. And really, this exhibition was a nice display of that. And so I want to share briefly in my last few minutes the evaluation we did of this program, and more so from the student side. And I will just say that sometimes arts and health interventions can be challenging to measure with typical instruments. They might not perfectly fit into a pre and post survey, or, you know, a typical focus group or some other sort of questionnaire. But that doesn't mean that their impacts aren't there. And so this is a great article that I'd recommend, just thinking about the right tools for studying these interventions when sometimes their impacts are hard to really grasp in some of those typical methods. And so we did do a program evaluation. We did focus groups with our older adults and surveys with our students. And I will just share this one takeaway here, which is that we found increased student comfort with older adults pre and post comparison, which was statistically significant. So that's really exciting to see, and I think a step in the right direction, that maybe programs like this can really help young providers and trainees gain experience with older adults and hopefully be more comfortable with them in those clinical settings as well. And so we tried to also advocate and raise awareness about this program, whether it be at conferences or even within our own medical schools, but really trying to highlight both the impact on the older adults, but also the impact on the medical students. And I think this shows how the arts and humanities can benefit, you know, multiple folks that are involved, in something that I hope to explore in the future too. And so I'm excited that this program has actually continued on. So next, I guess this summer, it'll be starting its 4th iteration. It was continued by other students in the last couple of years. And so we're hoping to keep this going. But it's really nice to see that this is a program that students have an interest in continuing, because they find it just as valuable to them. And so it's really exciting that, you know, this community is going to continue to benefit from this type of relationship with students, and that students can continue learning from the older adults as well. And so my big takeaway here is that I've tried to highlight the role of the arts and humanities on health professions, learners, and providers through more structured education curricula, things like BTS, museum-based education, but also shared a little more of my own personal experience using art for advocacy and for my own personal reflection. But my takeaway is that there's so many benefits for medical learners and providers. And I think we're only starting to really understand what those are and how to best design curricula and programs for students to maximize those benefits. And just a little bit about my future directions. I'm interested in utilizing the arts to improve medical education, really build better providers, and at the same time understand how they can also improve neurology patient experiences and outcomes. And so hoping to really incorporate those two fields together And I think it's really exciting to have opportunities like this and different settings to really raise awareness of the fact that the arts and medicine can be so intertwined and that there are a lot of benefits, not just for patients, not just for providers, but really for everybody involved. So these are my references, and I think I have a few minutes to take some questions. Thank you so much.
Thank you so much, Sujal. It is, I knew it was it was wonderful to have you present, but I didn't realize quite how wonderful. So that was been incredible presentation there, and really speaks directly to how the arts and humanities can benefit health professionals, both in terms of learners and providers. Thank you so much. I'm gonna get, I know there's a couple of questions there. I'm gonna get Catherine to ask the first question, if that's okay, and then Lana to ask the second question. Catherine, do you want to take it away?
Hi, yeah, thank you so much for talking about this. I'm super excited because I've also kind of going to be talking about something similar to this. So from my experience, this is a question that I had for you, is for medical students who are already very busy and may not think they need to engage with VTS because they might think that they already know how to observe. It's like not something they really need to think about too much. In specifically medical schools where it's an elective course, how do we impress the importance of this type of learning on them? Do we need to make this a core course for them, or how do we make them take it seriously for people who think that it's kind of a blow off?
Yeah, that's a great question, and definitely something I've thought about throughout some of these programs and activities. My medical school offers a required narrative medicine intersession as part of the end of the surgery clerkship, and so that includes everyone participating. And as part of a research project, I actually analyzed a lot of the student responses to that mandatory narrative medicine course, which involved some time in the museum. And there were some people that just did not like it at all. There were a lot of people that said it was a waste of time. They wish they could have spent it studying because they had an exam coming up. But then there were other people who said, wow, I really wasn't expecting this to be that helpful for me, but it really was. Like, it opened my eyes to something new. Other folks that said, this was really cool and I knew it was going to be really cool, and that's why I was excited about it. So really a range of responses. And I think there is some value to having mandatory courses because there's that subset of learners that doesn't really know how valuable it could be for them until they actually give it a try. But I think there are always going to be some learners that might be more resistant to it, and it just might not be something that they enjoy as much. And certainly there's aspects of medical school that some people might like more than others. But I do think it's important to give that exposure to people because I think for a lot of folks, it is very valuable. And it also might change with time. It might be something that as a preclinical medical student, you might think is not very important or you don't really see its application. But then when you're in the clinics and you're interacting with patients, you suddenly need conversations like that. And you need to have discussions, in the museum or using the arts, for example, and it takes on a new meaning. So I also think that if somebody is maybe initially resistant to it, it might be worth another try at a different point in their training where it might be more applicable for their own situation.
Great.
Thank you so much for your talk. That was wonderful to hear about. I would love to hear more about how you've personally been able to implement your arts background into your medical training and how it specifically influenced your study of the sciences, both as a pre-health student and as a medical student.
Yeah, absolutely. I think that has definitely been a core theme throughout both my pre-health and medical school journeys. And I think I remember applying to medical school and like 12 out of 15 of the activities were like art related in some way. It's like, oh no, is this maybe too much of the art stuff? But it actually was a real highlight in a lot of my interviews and conversations because it's something very interesting and different. But throughout my undergraduate at Duke, I spent a lot of time doing art activities with patients. So I taught art at the Children's Hospital. I led art gallery tours for folks with dementia and created my own artwork about like student mental health. And I think all of those activities, I really enjoyed being so interdisciplinary. And then I mentioned my gap year experience with folks with IDD. And then during medical school, with the Draw Your Story program, really enjoyed kind of incorporating that artistic side of myself into a more community service project and a community engagement opportunity. And throughout, I've tried to do kind of my own research, working like with some of the folks at Hopkins, like I mentioned, or trying to evaluate some of the arts and humanities opportunities at my medical school. And then also like just creating my own artwork on the side, like as I, if I feel like I need to highlight something or document something that I've seen clinically, a lot of times it will be through art or some sort of creative medium. But I think a lot of it, I've been lucky to have some really great mentors along the way. But sometimes I also haven't found perfect mentors, and I've kind of pieced together a team of folks that have different areas of expertise or even initiated projects on my own. So I definitely say, keep up the work that you're doing, and yeah, happy to answer other questions about it later too.
Thank you so much, Sujal. Richard has a question, which is, what is your favorite art media?
That is a good question. I think that has changed with time. But I think right now it's like ink pen drawing.
Mhm. There's an observation from Elizabeth. She says, I would think building observation, visual skills, cultural competency, perspective, and empathy could only help medical professionals, those who are dealing with the end of life care in particular, but really anyone. So thank you for that observation. I think there's time to squeeze in one last question. Perhaps I can take that, ask you one. Again, just so much to ask you, but I wanted to focus on the reciprocity of this process a little bit. Like you looked at how, let's say, patients felt more, in one of the last studies you mentioned, patients felt closer or more, I don't know what, felt closer to the, the students felt closer to the patients than they did before. And I'm wondering about whether you've looked at the other way around. Do patients then feel that the students are more accessible, the medical health professionals are more accessible as a result of doing this? Is it a two-way street? Have people looked at that?
Yeah, that's a great question. A little bit of that is something we touched on in our focus groups with the older adults with the Draw Your Story program, and I didn't share those results in my presentation today. But a lot of them talked about how they felt a lot closer to medical students and by extension, some of their other healthcare providers, which was a really nice takeaway. And I think another big takeaway from the older adult focus groups was this idea of generativity. A lot of them highlighted that they felt that they were doing a service to the medical students by participating in this program. And I think going in, there was maybe the perception that it might have been the other way around, that students are like helping this vulnerable community, and we're going in and we're like brightening their day with this program, which certainly I think was true to some extent. But the older adults wanted to participate because they felt like they were helping the medical students just as much, if not more, than the other way around. And so I think that was a really interesting takeaway, and one that really can kind of change your perspective of some of these types of programs, not just with older adults, but I think with any community population that might be seen as like vulnerable or underserved, is that a lot of times both folks think that they're kind of bringing something to the table, which they are. And so that was a really powerful takeaway as well.
That's great. That's kind of a new lens for empowerment and feeling included as well. That's wonderful. Well, thank you so much, Sujal. We will look forward to asking more questions in the panel discussion. We'll jump straight right to the final, let's say, lecture speaker for today, who is Richard Schaefer, all the way from Johns Hopkins University. So I'm so thrilled that you decided, you agreed to do this. I know how busy you were. Richard is an orthopedic surgeon and educator at Johns Hopkins. He grew up in Buffalo, New York, and attended college at West Point and medical school at Tulane. And prior to his time at Johns Hopkins, he served for 30 years in the U.S. Army, retiring at the rank of colonel. So it's a unique and unusual background bringing into this discussion as well. In addition to his clinical practice at Johns Hopkins, Dr. Schaefer is a medical student advisor. His scholarly interests include medical humanism and art and medicine, which is why he was invited to speak to this at this occasion. And so when not at work, he enjoys spending time with family, painting, traveling, and watching his beloved Buffalo Bills. That would have been quite a heartbreak. Last time.
Yeah, I'm going to talk about that.
Okay, great. He's going to
Yeah.
tell us all about how art imitates medicine and medicine imitates art. Thank you so
Yeah,
much.
thank you so much for the invitation. This is a wonderful conference. I've been taking so many notes, such inspiring talks. I am not a lifelong visual artist. I've come to that recently, and really enjoy it. And one of the roles that I have in my job at Johns Hopkins is a faculty advisor for students. So I'm a core faculty advisor. I have 28 students that I'm their principal advisor. It's a longitudinal program. I meet them before they start medical school. And usually by Zoom in July. And next month, I'm going to put the hood on at graduation on 7 students that I've known over the past 4, some of them 5 years. And so I'm going to talk some about how we use art in advising. I'm going to discuss the art of medicine, and I think medicine is an art. I'm going to talk about with my work with medical students, and if there's time, talk a little bit about art and patients. There's been some wonderful discussion of that already, and finish up with this discussion of an aesthetic mindset. Sir William Osler felt to be a great humanistic physician about over 100 years ago, said the practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. And I've been practicing medicine for a number of years, and more I feel this every day. Dr. Kong, this book, The Art of Medicine, says, medicine should, and Elizabeth, there was just a discussion in the chat about how emphasize empathy, human factor, sight, listening to patients, examining patients, and for the creativity, out of the box thinking. There's a lot of problems in medicine that have yet to be solved, and we need creative practitioners to solve them. So here's an example of of the art of medicine, and Sujal mentioned Closeler, and I'm going to show several examples of Closeler. It's a free online publication. I put the website in the chat. If you're interested in writing for Closeler or presenting, as an outlet for your own artwork and how it relates to medicine, please reach out. But Dr. Milstein, in this Closeler article, talks about a patient that said, "Hey, doc, I'd like some Valium." And instead of simply saying, "No, that's not good for you, a lot of side effects," to maybe, artfully ask some questions. What have you heard about Valium? Well, I hear it helps relax you. May I ask you where? Compassionately and curious, ask the questions of the patient instead of just dismissing the patient. Oh, I see. Have you heard about the risks of taking Valium? There are risks, and so this can prompt a discussion and a much more satisfying patient physician encounter. And in fact, Dr. Milstein, in this article, he compares the medical interview to performing jazz music. He says you can learn medical interviewing skills. You can watch others. I pick up things actually from the students. We teach medical interviewing to first-year students, and sometimes I notice ways that they're making eye contact with a patient or leaning in, sitting in their chair. I say that's very effective. I can learn from them, and vice versa. So thinking of the patient interview as a form of art is a way that medicine is an art. So here's a great example, another one from Closeler, where I don't think artificial intelligence is going to do this. 80-year-old patient with dementia lost her stuffed animal, and as they're making rounds, seeing the patient, I lost it. I can't find it. In that moment, I understood Precious Lamb wasn't just a toy. It was a lifeline to familiarity and comfort. So after rounds, the physician went to the gift shop, found a stuffed animal, brought it back, and the patient face lit up. The next morning, they saw the patient holding the stuffed animal, the lamb, and she was calmer and much more responsive. So a way of, instead of, there certainly is all the science and all the scans and all the medicine, but here's an example where the physician in the art of medicine made a decision to bring the patient a stuffed animal that was very effective. How about surgery? Well, that's, sorry, before I get to that, clinic wardrobe is art. So you mentioned I was in the Army for 30 years. I had no say in what I was going to wear. After I, left active duty and joined Johns Hopkins, I had to buy, a wardrobe, and I found that I really like wearing different ties. Sometimes, Buffalo Bills tie, for example, or Baltimore Orioles tie, and different holidays. I may wear a tie for that, and I didn't know that patients noticed it during Closler, or excuse me, during COVID. For a while, I stopped wearing ties. There was a thought that, I think I was wearing scrubs at one point. There was a thought that maybe the ties would carry the COVID virus and maybe shouldn't wear them in the practice in the clinic. And a patient that I had seen several times came in for a follow-up and said, "Where's your call? I miss your colorful tie." In other words, she had noticed that and noticed that I wasn't wearing it. So I went back to it. I've since added socks to the repertoire, and sometimes I cross my legs, and it gets a little bit of a laugh out of some patients that they see pink socks. So, whatever your shtick is, whatever way maybe you can interact with patients as a as medicine, as the art in practicing the art of medicine. And in surgery, there's a lot of art, believe it or not. I love this painting on the left, Thomas Eakins. In the past, they used to teach surgery as with students and other doctors looking down from an amphitheater, watching and learning while the surgeons do surgery. And in fact, in England and Australia, they call the operating room theater. That's what it's called. What do we have for theater today? And I love that. And I think that it is a symphony going on in the operating room. In fact, there's some art, there's some music to what the surgeon's playlist is, what music is being played. People have their choices. I used to like Hawaiian music in the operating room. This is a poem by the late Richard Selzer, a surgeon. The knife. One holds the knife as one holds the bow of a cello or a tulip by the stem, not palm, nor grip, nor grasp, but lightly with the tips of the fingers. The knife is not for pressing; it is for drawing across the field of skin. So, surgery as an art form, and a lot of times surgeons have to be creative during surgery to come up with solutions. Sujal mentioned Closler as an outlet for her work. This is Matea Miller was one of my advisees, published this in Closler, like Sujal showed you her example. Finding parallels. My first day in the OR, I was apprehensive. That first day in the OR, I fell in love. The elegance of operating on the head and neck, removing a tumor, restoring function, improving patients' quality of life, it brought me joy in medicine. Much like pottery brought me joy in my personal life. I left that day beaming, excited that I'd finally found a place where I belong. So, Matea, the question was asked of Erica and how she's in musician and in medicine, and I think of things like Matea's future otolaryngologist. She's in training for that. She also loves. She's a potter, and how those two aspects of things they're complementary. They're all part of her collective identity. I love this quote by Paul Simon: "Medicine is magical, and magical is art." That's from the song "The Boy and the Bubbles," and I believe that medicine is magical. So if the practice of medicine is an art, art can help its practitioners. And Sujal mentioned these: diagnosis and observation, empathy, dealing with ambiguity, communication, preventing burnout, increasing joy in medicine. Just like Matea mentioned, how her joy in surgery and relating it to her love for pottery and developing creative solution. Sujal mentioned the fundamental role of this frame, the arts and humanities and medical education. The arts can teach students creative means of expressions and an awareness of emotions, among other things. The integration of arts and in medicine and medical education may be essential to educating a physician workforce that could effectively contribute to optimal healthcare outcome for patients and communities. This down here in the center was a couple of students and myself sitting around chatting, painting the Hopkins Dome, and chatting about school, chatting about life, and enjoying just a small group discussion and watercolor painting. And I'm going to show you some other examples of that. So these authors, creativity and medical education, the value of having medical students make stuff. Time should be devoted to having students create stuff. We don't need doctors to be, bona fide, selling their artwork or necessarily dancing, Broadway, although they could be. They could be publishing their poetry, but we do need them to be observant, articulate, and comfortable with human body. We need them to be creative problem solvers and find new ways to address questions, and that art, creating things, can help them as a hobby, but it can also help them become better doctors. So here's an example of something we had recently at Hopkins. The Arts and Medicine Society had a workshop, and I love artist Alma Thomas, her work, and so we led. I led a session. We had these mini canvases where people, in the Alma Thomas technique and style, painted something of their choice, and I think there's a kind of a with as a group, a collective work, working, not necessarily working together on a collective painting, although it could be, but working together, chatting, some of the conversation, first year student, there's a second year student talking about their course, and the first year student asking that student questions about second year, and just informal discussions and mentoring and sort of mini advising going on in a session like this. That's very relaxing, and you get some cool art to put in your office after that. So this is just one example, and in fact, Johns Hopkins had a Second Look weekend recently, where students that were admitted come to Johns Hopkins and decide if they want to matriculate in August. They did have a session of like this with mini canvases and art where the students could paint and sit around tables of like 8 or 10 with upper class that were and myself were at the tables and chatting about Johns Hopkins while they're painting. And so just a small way of using art and incorporating it into medical education. One of my students coined this term collegial collaging. We sort of just recently started exploring collaging in my small groups. I think it's a cool team building. Doesn't require, something, I can't draw. It doesn't require advanced art skills. You can't draw. Okay, well, you can cut things out of a magazine, and sharing aspects of personal or professional identity. I had a group of students at my house, and we made a group collage. It was a lot of fun. I think there was a group flow. Some of the things they selected, these are first semester medical students. Be scared and do it anyway. Maybe it's a reflection of some of the anxiety of starting medical school. One of the students, selected that for a reason. The students are all, they were in a first semester course of medical interviewing, learning how to talk to patients and get a history from patients. And one of the questions that they would ask the patients, trying to remember, how's your knee? Well, it hurts. Well, tell me more. They were learning, trying to, the art of medicine, if you will, the art of medical interviewing, and they put that on the collage. Tell me more. And is there anything else you want to talk about today in your visit? And another, sharing some of their personal identity, uh, home states. One of the students liked to fish, and one owned a cat. I think the cat's sort of the group mascot. And even, I heard them laughing, and they put my small head on this scrub Play-Doh body. So having some fun with it, and, teasing each other. This is cool. They just got their stethoscopes, and uh, they put this stethoscope like a Play-Doh, this was on the collage, on a dog. So I'm not sure what the visual thinking strategies here is, but I'm sure there's something. But it's kind of a fun way of a group activity that and since then these students really they got into sort of collaging, sort of mini collaging. They had a Friendsgiving, and they made a small collage while they were doing that, what they were thankful for, and sent me a picture of that. So I think there's something to this. Um, at Johns Hopkins, we have an annual, and I probably a lot of medical students do have an annual medical student research symposium, and it's great. The students are some are presenting at the podium, some are presenting a poster, and they're standing by their poster explaining their research on whatever it is, an orthopedic procedure, long COVID, and they really put a lot of effort into that, a lot of effort into their research and their presentations, and it's great. Well, I was walking through there with one of my advisees, and we started this conversation and said, this is wonderful, but why don't we have a medical student art symposium? Wouldn't that be great? Um, that student got a group of students together, and now we have it. We call it Hopkins Evening of the Arts. We've had two of them. I've heard one of the, some of the words I've heard, mentioned a few times here in the sessions. Community. We called our first one "Building Community Through Expression." This was open to the entire medical school, and any kind of art that a student wanted to display or perform. Group activities were encouraged. It was not a juried type of exam. All any skill level. This was we thought about having awards, and we decided against it, thinking that this is not about a competition. This is about participation. It's another word I've heard. This is about encouraging students to participate and get together as a community. We have a wonderful a cappella group. This year, I asked them if they could lead a sing along, and they did to Natasha Bedingfield's Unwritten. It was great. So they did a couple of verses, then release your now everybody, and people feel it was great, and I think sort of encouraging participation, people that otherwise wouldn't sing publicly, but they're participating in that. Some students a group got a barbershop quartet together. They said that, gee, I hadn't been singing in years. I used to love it, but since we had this Hearts, they got together and performed. There was even a magic show this year, and different types of dance: Bharatanatyam, hip hop, salsa, Latin dance, performances, and spoken word. And we wanted to make opportunities for everybody that came, certainly enjoy the performances, but opportunities for everybody to create. There was a student led a pottery workshop off to the side where you could come. Hey, do you want to make a pinch pot? I've never. Yeah, I'll show you how. And we even had crayons on the table. And this year we had Play-Doh, little tubs of Play-Doh for students to mold something that maybe they hadn't touched a crayon since third grade. But there were opportunities to do that. The photo booth was another word I heard this morning was playful. An opportunity for play. The photo booth was really a great opportunity for play. When I look at those photos of, you know, the smiles, creating poses, you know, some of the silly faces, little signs, cray. I think was playful creativity and group photos. So that was really wonderful. We had a visual art walking gallery, and we've had all types of art, pottery, crochet. Some students submitted a sweater that she made. Um, uh, here's a crochet bag. There was photography, painting, drawings. This is one of my personal ones that I enjoyed. Student chose to remain anonymous, listed as the artist is Abby Normal. And I think I look at this trying to use what Sue calls the visual thinking strategy on this. I really enjoyed this work of art. I did because I saw the thing. I knew which student did this, and I asked that student, you know, what they were. So, well, it's open to interpretation. It's whatever your interpretation is. So I really enjoyed this work of art. We also had another group drawings and paintings. A student drew this hands holding a heart on a 3x5 canvas. And during the event, students came by and you know, filled it in. And I love this painting. I think it speaks to a lot of things, but one of the things is the diversity within our student body is one of the things that it speaks to me about. It now hangs in our medical school. We have 4 individual colleges, sort of like Harry Potter, Slytherin, Gryffindor. The colleges are named after famous Johns Hopkins faculty, Tau Sig and Thomas, and they all have mascots, and each college had a mascot that was painted in during the event. And opportunities afterwards for students to publish their work. This is one of the paintings called Community that Carolyn M. showed at Hearts, and I reached out to her about Closeler, and she published it in Closeler online. Again, it's free online, and you don't have to be Johns Hopkins to publish. But she talked about community, and this painting celebrates individuality of everyone, but also highlighting the draw we can draw from our own community, the help we get from our own communities, and how multifaceted. So wonderful description and about this painting and relating it to medicine. I mentioned dance. There was a group of students did Bharatanatyam dance, including Ajitha, and she hadn't danced in a while. She used to love doing that when she was growing up, but the opportunity came, and so they got the group of students together and did a great performance. You know, sharing cultural expression, cultural dance, these beautiful costumes, and she said, Ajitha said you know, when she rediscovered her love for dance, it made her think artistically. And when she was on the wards, she had a patient, Mrs. M, and as she was talking to Mrs. M said she enjoyed painting and drawing, but wasn't really opportunities to do it while she's hospitalized. Well, Ajitha and some other students got some art supplies for Mrs. M, and Ajitha and Mrs. M, you know, really appreciated that, and she drew a picture of Ajitha and gave it to her. So really a fantastic connection of the patient and the medical student who's taking care of her, connecting over art on the wards. And I like this, Ajitha. You know, strengthening my heart with the arts, I've been better able to connect with patients, and highly encourage everyone to continue their passions by being in tune with the aspects of life that make us whole. We are better able to give excellent care and create meaningful relationships with patients and colleagues. In our curriculum, in our small groups, like I said, I work with students, group of students. We call it a molecule. So a first year molecule, a second year, and we work longitudinally. And built into the curriculum, we get together periodically as a small group to have a discussion. There's a prompt, and it may be, think about, a patient you've had in the past rotation and something that troubled you about it, or when before they're starting on the wards, we have a session, think about what you're thinking of, what your concerns are as you transition from preclinical to clinical phases. We also have another um, uh, we also have another session on substance use in medical students and physicians. And so we create a safe place. Students feel, we ask them to share what they feel comfortable with. And the curriculum has it, we'll give a prompt and then take 10 minutes of quiet, reflective writing. And I introduced reflective drawing a few years ago, and that's been for some students, they seem to enjoy that better. Some of the drawings, these are not them; these are my drawings on PowerPoint. But one of the students drew an empty bed and used that to prompt a discussion about a patient dying in the hospital, death and dying. And so that visual of the empty bed, and I said, that was really powerful. There's been a number of different weather patterns that I've seen drawings of: sunny days, rainy days, how the students, mountains being, feel like mountains being climbed. One recently, a student showed a mountain, but also underneath the mountain was sort of abstract of the people in that student's life lifting the mountain up. I thought was really cool, that helping that student climb that mountain. So it's kind of it's a reflective drawing, I think, is really kind of a neat thing, and maybe something that could be studied more. So I think I do a lot with medical students, and what about practicing physicians? Uh, well, a group of our medical students at Johns Hopkins presented a narrative medicine session at recent American Academy of Orthopedic Surgeons in San Diego. So I myself and Don Laporte, we were the faculty members, but these 5 students, they designed this, they presented it, and the presentation included a sort of draw your story session, like Sujal's going into the and very interesting. This was, I thought about the intergenerational session that Sujal talked about. This was intergenerational. These were medical students, and there were practicing orthopedic surgeons attending this and drawing and sharing. And one, I'll give one example. The very senior, experienced orthopedic surgeon shared a story about a patient of his that was a veteran. And that story was so powerful to that senior surgeon, and he used that opportunity to share it. The surgeon almost started crying, remembering that story. And I don't think, unless he, went to this session, that I don't think he would have appreciated the power of that story. So it was really cool, and it was intergenerational, and it's felt to be in orthopedics. I think our patients have stories, and we have stories, and I think we can do more in this area for practicing physicians, and the medical students we're teaching are the ones to do it. Um, a little bit about art for patients. There's a current exhibit at the National Institute on Drug Abuse by artist William Storr, and It's called Art for Hope. And these paintings, and he published this in Closler. Often hope emerges when someone sees themselves in a painting and realizes they aren't alone. He writes that a woman wrote to me and said that after seeing the patient, she knew that I understood her, a woman with a substance use disorder. I understood her as well. She wrote that she wanted to die. But the next morning, she looked at that very same painting, and this time she saw hope in the woman's eyes. And she then understood that she too could have hope. She said that painting saved her life. So, a beautiful example of art helping patients. Um, I, it's mentioned that I served in the military, and for soldiers, there's been some very good work done in the I mentioned this morning some about the Veterans Administration, and um, at Walter Reed making masks to reveal the hidden wounds of war. That soldiers they may have difficulty talking or writing about their experience, but painting it uh, some have been able to do that, and then as part of groups share with others what their mask painting what they're feeling. I've participated in some mask painting. And I'm going to do it next month at a humanities conference in Bethesda. The Uniformed Services University does this for their students, and so it's a neat way of doing of using art. It's kind of like reflective drawing, reflective painting, using paper mache masks as a media. Well, art can benefit patients. Art can benefit practitioners. And Hippocrates, way back when, said, wherever the art of medicine is loved, there is also love of humanity. And so when I think about art, the art of medicine and art benefiting patients and practitioners, um, in a way, then art benefits society, because we can use this as an example of how we should treat uh, patients humanistically and treat each other humanistically in society. So I think that this I love this quote by Hippocrates. And Susan Magsamen and Ivy Ross published this book, Your Brain on Art. Susan Magsamen is the director of the Arts and Mind Lab at Johns Hopkins, which is looking at the intersection of art and the brain, art and neurologic function, and uh, very interesting science. The book is interesting, and in the book, and she and others talk about an aesthetic mindset. It means you move about in the world in a way that's curious, in a way that encourages playful exploration. There's that word again, sensorial awareness and interest or passion in making or beholding the arts. And you don't have to be good at it. uh, I think, with what we're trying to do with hearts, to provide an opportunity for everyone that participate, whether it's singing, humming, collaging, writing, any way like that. So I think we really want to encourage our medical students all to participate in some way. And again, at our hearts program, there's no judgment. There's just sharing. So in ways that I try to cultivate an aesthetic mindset, I guess. I'm like I'm not a lifelong visual artist. I'm new to painting, and I admire those that can draw something that's recognizable. I tried to take a drawing class, and um, sorry, I dropped out. I didn't have the patience for it, but I like putting color on paintings, and these won't hang in the Louvre, I know, but they hang in, or the Baltimore Museum of Art, but they hang in my office, and I find it relaxing to paint and trying to cultivate an aesthetic mindset. And I think it makes me appreciate things like this sunset a little bit more. The sunrise this morning was, as I was driving to work, with particular pink colors, and this is a few weeks ago at our Hopkins Dome with the tree blooming. So I think it makes appreciating. And so bear with me. I think of sports as an art. Football game as think of it like an opera. There's performances. It's like an opera, except you don't know how it's going to turn out. There may be high drama, and as far as your creativity, you may have to be creative about what you're gonna wear. You get a chance to yell, and different than an opera, you get a chance to yell and sing. Hey, Georgia Bulldog fans, you bark. I mean, between the hedges. So you get a chance to do that, and I think of it as some way to create an aesthetic mindset. And even the other thing I think about sports, I'm an intense Buffalo Bills fan, and it is heartbreak, the losses we've had in the playoffs. But I think about the highs and lows of being a fan, and at the end of the day, it's not critical, but you get a chance to feel that. You feel those. And I've had even patients that are commiserating with me. Somebody came in the day after the Bills lost, and she said, "Oh, I was thinking about you last night with that loss. I'm sorry." So I think of sports as art. There's actually an Instagram site. I don't know exactly, art but call it sports, something, or sports but call it art, something like that. And they have paintings, and then they'll have a painting, then they'll have a picture of Rory McIlroy at the Masters that's kind of a similar pose. So thank you very much for this opportunity. It's great. I've learned a lot. I've been inspired by the talks, and I really appreciate the opportunity to share some of my ideas.
Thanks so much, Richard. That was fabulous. I will essentially push it to, wait, I'm not really sure what's going on with my screen. I'm sorry if it looks strange on your end as well. This was wonderful final, let's say, full lecture for this session. I'll get Lana on. She had the first question to ask you, and then followed by Catherine. And for anyone who has questions, please put it in the chat window.
Hi, thank you so much for that talk. That was really amazing to hear about. I was just wondering, you mentioned that this was not a lifelong passion and it was something you picked up more recently. So I would love to hear more about what inspired you to make this discovery and become more involved in the arts later in your career.
Oh, thank you for that question, Lana. When I finished my residency, I was in the Army, and I was my wife and I, we went to Germany. We were stationed in Germany for 2 years, and went on a tour. Okay, we signed up for a tour. We're going to Paris. So when Paris, the bus stops at the Eiffel Tower, the bus stops at the Louvre, and so going through the art museum and saying, "Gee, I wish I knew a little bit more about this." That's kind of, people are crowded around the Mona Lisa. What is it? So just trying to learn a little bit more about what I was looking at. There's a great book by Rick Steves called Mona Winks that takes like 5 or 6 paintings in the big art museums in Europe and gives a discussion on them. Some of them even like funny, like look at the dirt on the foot of the person kneeling there. So I learned a little bit about art then, and so more recently I mentioned Alma Thomas, her abstract art, her there's her color fields. She has I have this book, a kid's book, Alma's Art, that I like, a book about her art for children. And she paints these Alma stripes. And I thought that was I loved her paintings, and colorful, and they made me feel good. And I thought it was approachable, like something I could try to do, not this colorful, but I could try to put those on a canvas and or drawing and see what it looked like. So that was sort of my introduction to doing that, and I found it very relaxing. And so I became more interested in that, and I've mentioned one of my student advisees was very interested, and we had this discussion and about having a student-wide art symposium, and away we go. Catherine, was there?
Yeah, for sure. I can go next. This might be a little bit more of an individual question, but it's so please feel free to use your experience as an orthopedic surgeon. But I was wondering how and if we can teach surgeons to be creative in times of emergencies. Like, is that just through years of practice that you can come up with creative solutions in an emergent situation? And do you feel like your students, have you seen a shift since you've started these types of programs at Johns Hopkins? That have you seen a shift in how they practice?
Um, Thank you for those questions, Catherine. I think there's a number of things can be done in terms of em- you know surgeons or physicians performing in emergency. Um, a big one is training and simulation. There's there's courses that are advanced trauma life support, advanced cardiac life support. So that's one, trying to train and prepare for them when it's simulated. Um, the other is maybe taking like that learning from a jazz musician is experience, is as part of a apprenticeship model of training to be a surgeon. Uh, I was apprenticeship model training to be an artist. Apprenticeship model where um, one is observing a surgeon, they're assisting, and having role models and mentors, and seeing how they manage um, unexpected bleeding or urgent surgical decision. I also think that uh, maybe things like emotional intelligence can play as well into that. Have I seen a shift in the students um, with that? I don't know that I can't say from like a validated survey instrument or anything like that. I can say that, and I showed some examples of some wonderful written and visual reflections of the students and their artwork and relating it to medicine. And I've had, and there's more. There's more that are on Closeler and others, and I'm always encouraging students to consider. I'm on the editorial team for Closeler, full disclosure, so we're always recruiting writers. Um, and readers. So I don't know that I can have an instrument, but I've seen those. The other thing I think as an outcome measure, I was looking at the photo booth gallery recently from our recent Hearts, um, and maybe and seeing all the smiles and the students, different poses and so forth creating that they created. I thought from a wellness standpoint that made me feel good. I think that the students seem to be having fun at that. And I thought that, I'm in charge of the budget too. So I said, well, that photo booth was well spent.
That's great. Thank you so much. One final question for you, Richard, if we could quickly do it, was one from Erica, which she asked, I'm curious as to how faculty at the School of Medicine interface with faculty in arts and humanities departments at Johns Hopkins. What collaborations, interactions, possibilities are there?
Yeah, that's great. I would like to do more myself. There may be others that are there. There is a I learned recently, I'm not involved with it, a Hopkins Medicine um, orchestra. And Wait, Lana, you were telling me about a Hopkins course. What was that? Tell me what that is. I need to go to that next year, maybe. You were at Johns Hopkins.
Yes, it was like an undergraduate research symposium that they were doing there.
Yeah, so I think that's an area that we could potentially collaborate more. So thank you for that question, Eric. I think there may be others that are, but I would like to do more. There may be others other than me that are collaborating in this area, but I personally would like to do more. So thank you for that question and that inspiration. I don't have a good answer, but maybe that's one. I can learn more about that, Lana, from that one you went to.
Excellent. Thank you so much, Richard, for wonderful, wonderful presentation. We'll follow in for questions in the panel discussion, but I'd like Catherine to take over now. And we're going to have our two short presentations, one from Catherine and one from Lana. So I'm just going to briefly introduce Catherine, who very kindly reached out to be involved in this. She is an Excellence in Patient Care Associate at the American Society of Nephrology. She graduated relatively recently, May 2024, from Washington University at St. Louis with a degree in biology and a concentration in neuroscience. So during her time there, she helped lead the medical humanities department after being introduced to connections between arts and medicine. So this sparked her passion for public health and her commitment to ensuring equitable and quality health outcomes for all populations. So she's medically trained and certified and has worked with and volunteered at several hospitals and clinics. And she's currently focusing on providing high quality care for kidney disease patients through federally funded projects. I'm really curious and keen to hear about Catherine's work in training medical students and other health professionals. Take it away.
Hi, yes, thank you. I'm going to be kind of repeating a little bit of what Sujal talked about with VST or VTS, but I'm really excited to be here and thank you so much for having me. But hi, everyone. My name is Catherine Niles, and I've worked in and taught and studied the medical humanities at Washington University in St. Louis for 4 years and at UCLA for 2 summers. But 2 years ago, however, I worked in a direct medical setting as a medical assistant in a dermatology clinic. And today, I wanted to pose to you a scenario and maybe even a scenario that I had encountered while I worked there that demonstrated to me that medical students and maybe even undergraduates should have required training in specifically the art of observation and communication. So before I begin, I do want to disclose that the pictures I'm going to be using aren't from the clinic that I used to work at for patient privacy, but they are incredibly similar to things that I have seen. And also, just to give some context to those of you who may not know, a medical assistant's role in dermatology clinic includes things like rooming patients, recording their medical history, which includes their chief complaint, and then that information to the dermatologist. And during the patient visit, medical assistants also take notes for the dermatologist. And in my clinic, we took physical notes, which include a diagram that looks somewhat similar to this, where we would write notes about what we see on a patient. And also occasionally, multiple medical assistants might be involved with the same patient. So for example, one medical assistant would room the patient and then another would assist in note-taking. So for one of my experiences was one day I was reviewing another medical assistant's notes before entering the room, and I saw that the chief complaint was a mole on the posterior side of the patient's right shoulder, and it was described as a mole with a dark brown center and a notch at the bottom. So I'm going to take a second. I want everyone to also take a second and visualize what that looks like to you. So if you have a piece of paper near you, if you're taking notes, I highly recommend you try to draw it, or if you don't, by all means, just feel free to visualize it. So I'll give everyone a few seconds to do so before we continue. Right, so hopefully you've visualized and or drawn it. And so hold on to those visualizations. So whenever the dermatologist and I actually went into the room and looked at the patient's right shoulder, we saw something that looked like this, which is not exactly what we were picturing whenever we heard that description, read that description, and it may not be what you were picturing either. So I want to break down this description. So we established that it's a mole, but what does a mole look like? It can really vary depending on a lot of factors, as you can see here. Dark brown. How dark of a brown? And brown is made by combining red, yellow, and blue. Are all those pigments equal, or does the brown have a certain hue to it? And then finally, a notch. How deep is the notch? How big is it? Is it spiked? Is it curved? What does that truly mean? All of this is to show that the description was pretty vague, and it's vague enough to where our own personally held ideas and bias of what something can look like doesn't allow us to visualize the quote-unquote correct mole. So I'd like to take a closer look at this mole and describe it together. So the size of the mole is about the width of that fingernail there, which is probably around 8 to 10 millimeters wide if you were to think of the average fingernail width of 9 millimeters. So we have a general idea of size for it. The mole itself has an irregular border. It's wavy, it's a little blurry, and it's definitely not well defined. The mole itself is flat and smooth. Examples, as we talked a little bit about earlier, moles can have different looks and appearances. So versus raised and smooth, raised and pebbly, we have flat and smooth on the right. And then we also know there's a large color palette for this mole. And 4 colors is large as far as moles go. You can see there's a typical brown as indicated here, a reddish brown, a dark brown that's kind of localized at that left hand side. And within that dark brown, we have darker brown spots that look almost like black spots. And also, no matter how you try to cut the mole, it's asymmetrical. You can't make the two sides be a mirror image of each other. So to recap, we've gathered these types of descriptors, but why is that important? Because we've just described 4 out of the 5 indicators of melanoma, which is one of the most dangerous skin cancers due to the high likelihood of which it can spread to other parts of the body. And with just my words, I can describe something a dermatologist would immediately want to biopsy, if not completely remove. In this situation, articulates clearly the importance of not only observational skills, but the importance of properly communicating important observations to other care team members, and therefore ensuring proper patient care. Yes, the description on the right is maybe longer, but it gives you a much clearer picture of what's going on. As I said before, everyone has their own idea of what a mole could look like, so it's not enough to simply describe a mole as a mole. You need to include objective descriptors so everyone can kind of see with the same eyes. And for my own opinions, if a medical professional doesn't know what's important to share from the case in front of them, they're not going to be able to clearly explain to the patient or to the rest of the medical team what's going on or why they're choosing a certain care plan. And if they miss key parts of the case due to a lack of observation skills, that could lead to care that potentially is harmful or might mislead other care team members. As you could probably tell, I believe this was posed a pretty big problem. So it got me thinking about, when do physicians learn how to observe? Is it through continual case studies, practicums, something that you just learn over 20 years of practice? Where in medical training do we teach students this? We obviously value it, so how can we effectively teach it? And these questions led me to Dr. Erwin Braverman, who is a dermatologist and professor emeritus at Yale School of Medicine. And he saw that his dermatology residents, they were having a hard time describing something completely unfamiliar to them. And if they were presented with that, they would over-describe it because they didn't know what key details were important. So they just included all of it. They relied heavily on their prior knowledge for dermatological cases. But as we know, every patient, every case is different. So Dr. Braverman recognized that if you just look for patterns in dermatology, a lot of what we do is patterns that are already known to exist, you can miss a lot of other things if you're just searching for those patterns. So how can you teach someone to observe and articulate key details about things that they're unfamiliar with? And Dr. Braverman came up with an idea that he and I think it was a little bit before 2001, that he wanted to bring his students to a museum and have them observe and describe narrative 18th and 19th century British paintings. These kinds of paintings usually have some sort of ambiguous or conflicting visual details in the story that they're telling, which is very similar to a complicated medical case that you might see. And so when students were presented with these paintings, Dr. Braverman would ensure that students didn't interpret any data from the paintings to come to a conclusion and to only rely on their objective observations. And after weeks of doing this, he started noticing that students' clinical observations were improving. And so he expanded this to medical students. And he did a 2-year study where he had 3 different groups of students. One took an anatomy lessons and did X-ray reviews. Another practiced history taking and physical exams. And the third group visited art museums to closely observe and discuss objective features and works of art. And each group took a test in the beginning and the end of the study where they were asked to identify clinical features in patient photographs. And out of the 3 groups, the group that went to the museum improved their observational accuracy by 9 to 10%, while the other groups showed no significant change, which to me is incredible. And it shows that refining the skill of objective observation by describing art carries over to being able to find objective visual clues in clinical settings. So since then, Yale has made this visual training through art observation a required course. And it's something that I would argue would be beneficial for all medical schools and maybe even undergraduates as undergraduate schools to also include as core, because observation skills can take 10+ years to hone. And I myself have been trying to foster this type of learning in undergraduate settings. I was taught this at Washington University, and I continue to teach it at Washington University and brought it to UCLA, where basically I brought the museum to the students. And I gave them a bunch of different photos that were kind of wacky, kind of weird, and I had them pair up, and I said, you can't talk to your partner. You have one person who has the picture, you have the other partner who is just drawing based off of the other partner's description. And so what this does is it forces them to see how hard it is to actually describe something that is completely unfamiliar to you. Because a lot of people discount how hard observation skills are to build. And it also forces them to work on how they communicate their observations to their peers. Because some students you could probably see in a lot of these pieces of art that some things have, the scale of it is different, or it's too far with the sunglasses is too far to the right. Where do you start to describe something in a photograph? Do you go big details to small details or small details to big details? How do you communicate this? And so it was really cool to see this over now, I guess, 3 years that these students have tried this. You would have them do this. Well, each student does it 2 times. So in total, it's 4 rounds of this. And you learn as you hear it being described to you, you learn how you would wish that it was described to you. Or whenever you describe, you learn more as you continue to describe that to your partner. So it's really cool, and it's something that undergraduates, I think, should be exposed to as well. So I hope I didn't run too much over time, but thank you so much for allowing me to speak about this. And hopefully this contributes well to the discussion.
Absolutely, Catherine. I thought it was absolutely phenomenal. And I think you made to have concrete examples is so useful to bring across how important this is, really. And I loved how it started with the visual observation, but the narrative is there as well, the description, how that's so important as well. So thank you so much for that. I'm going to jump to Lana, and then we'll take a panel discussion for all the questions and add a spotlight there. Lana, do you want to start your presentation while I introduce you? So Lana is a student in my lab. She's a 3rd-year undergraduate at the University of Georgia, pursuing dual degrees in biology and mathematics with a minor in art history as well. And her plans are, of course, to attend medical school after college. She's originally from Denver, Colorado, and is passionate about bringing scientific innovation and creative arts into clinical care. So her research spans orthopedic surgery, medical device development, and integration of creativity in medicine. And she's co-authored several forthcoming papers and conference presentations across these fields. So outside of academics, she enjoys cooking new foods, traveling, and hiking in new places. And it's a delight to have her in the lab, and I'm looking forward to her communicating the results of our recent review in this short presentation. Thank you, Lana.
Thank you so much. So just a little bit about my background. Like Dr. Abraham shared, I'm studying math, biology, and art history, so I definitely have some interest both in the sciences and in the arts. I definitely think that the arts have inspired me to think outside the box. They've really contributed to my clarity of thought in scientific disciplines. And when I started to notice this experience that I was having, as well as the overlap among renowned scientists that were also engaged in the arts, I decided to conduct a comprehensive review of the literature that has analyzed the prevalence of these coupled interests. So the medico-artist phenomenon was coined by Weitz and Albury in 2009, and it refers to how studies have shown historically high rates of artistic hobbies among top physicians. So this
Lana,
study looked at.
Are you sharing something? Because we can't see it in case you
Oh,
are. Just the share function, you have to press below. Perfect. Now I can. Yes.
okay. I'm so sorry.
Nope.
So the medico-artist phenomenon was coined by Weitz and Albury in 2009, and it refers to studies that show high rates of artistic hobbies amongst top physicians. So this looked at the historical intertwining of medicine and art, but also noted that despite increasing standardization in the medical field, this correlation with the arts still exists to an extent that's not seen in other disciplines. So what was most interesting to me about this research paper was that the correlation was also demonstrated in studies of basic gross anatomy and other sciences. So it extended beyond clinical practice and into the actual cognitive realm of learning about medicine.
I'm so sorry, Lana, but I think it's not load. It just says loading on the page that we see it. If anybody else is seeing something else, let me know. So it's showing a full screen, but it hasn't actually showed you images, if you know what I mean. So try to just get out of it again, like escape.
I'm so sorry. I'm not
No
sure.
worries. I'm not sure where. Oh, there it is. I think it's now we can see it. So maybe slideshow. Don't know. It's not working. Can anyone else see anything? Just say yes or no.
No, it's
No,
just
I'm not seeing
yeah,
anything.
just Lana, can you see it on your end? Or
Yeah, on my end, I see the full.
oh no. Yeah.
Okay. I would say just start try to. We can see it over here. It's not really working. So
Maybe go from that last page, Lana, just yeah, like that.
yeah, just
Okay.
go page by page instead of yeah, exactly.
Okay. I'm so sorry about this.
No worries.
Okay, so yeah, so the question is, why are physicians in particular so drawn to artistic pursuits, and if there's an intellectual connection or if it's primarily therapeutic? So our research questions were primarily, how has creativity been reported to correlate with excellence in medicine? So looking at what has been reported in the literature about this overlap. And then sub-questions that we put together after reviewing all of the papers were how the skills required for different domains of medical practice, so that's cognitive, emotional, interpersonal, and sensory motor domains, and how engagement in the creative arts enhances those areas of medical practice. So this was kind of how I split up these skills. Within each primary category, there were a few subcategories that were addressed in the literature. So under cognitive skills, the literature talked a lot about general cognitive abilities, technological innovation, problem solving, and diagnostics. The interpersonal domain talked a lot about leadership, patient communication, empathy, and humanistic perspective. The emotional domain talked about motivation, ethical decision making, emotional and stress regulation, and burnout prevention. And then sensory motor domain, we looked at fine motor skills and observation. So all of these sub skills were ideas that were emphasized in the papers that have been published on physicians engaging in the arts. And the other talks today have gone in a lot of detail about specifics. So for the sake of time, I might just give a general overview of what we found under the primary categories. But here was the methodology. We used PubMed, Web of Science, and PsycInfo to kind of scope out different types of papers that have been published in this field. And when we look at the distribution of topics, mostly every paper fit into more than one subcategory of interest, with the most common interest being emotional and interpersonal domains. So a lot of papers would talk about how engagement in the arts not only helps physicians with burnout prevention or motivation in their own careers, but also helps them better engage with their patients and connect with the people that they're working with. So for the emotional impact, this domain demonstrated most of the representation in the literature. So a lot of psychological and emotional benefits for the actual medical practitioner, and how that helps. Engaging in the arts has really helped physicians find meaning in their work. For the cognitive impact, this looked at the expansion of cognitive potential for medical professionals. So like some other presenters have talked about today, looking at how you can be a more creative problem solver when you're engaged in the arts, and how important that is, not just for medical students and for learning these skills, but also for practitioners as they move forward in their careers. And then interpersonal impact talks about social skills, working with patients, making them feel cared for and prioritized and heard. That was another big part of what the literature talked about. And then the sensory motor category was less talked about, but definitely still addressed. And it talked a lot about how creativity and engagement in the creative arts improves manual dexterity for procedures, and also observation and precision, like Catherine was talking about in dermatology. So, some implications for medical education is that this is really important and definitely needs to be studied further. A lot of the papers that were found talked about they were observational studies, or they were simply testimonials, which of course is very important and valuable, but there was not a lot of empirical research actually looking at how engagement in the arts can benefit a medical practitioner or even benefit medical students. Most of the research done on medical education were short-term assessments of program implementation in medical humanities. And so this definitely still needs to be further addressed, especially in the cognitive category, because a lot of the literature does look at emotional engagement and how it may enhance interpersonal relationships. And then just some additional considerations. Some of the previous speakers have talked about this, but looking at passive observation of the arts versus the participatory arts. The medical humanities and medical arts tend to be lumped together, but maybe assessing how these different fields help in different realms of medical practice would be beneficial as well, so that we can really encourage not just medical students, but also residents, physicians, people all through their careers to engage in creative hobbies that they may have given up on, thinking that it wasn't a necessity and a major importance in their career. So moving forward, we are looking at doing a psychophysiological study on how the creative sciences and creative arts kind of help each other, and how engaging in scientific problem solving versus engaging in artistic creativity really help each other and help scientists and artists improve in their respective fields.
Okay, thank you so much, Lana. I will thank you. That's perfect. I will now shift it directly to the panel. If anyone has questions, I'm going to add spotlight all of the speakers. Sujal, if you could put on your camera, I would then be able to spotlight you as well. And we can start with some questions. Do you have any questions for each other first? I want to give you the chance to perhaps ask them if you do have them. If not, we can jump right into the Q&A from the panel moderators. Anything that you haven't got the chance to ask yet? Okay, everyone listening in, please add your questions to the chat window or use the raise hand function. I'll keep looking in to see if there are any comments there, any questions. We have just 20 minutes, so use your opportunities when you have it. I want to sort of start on what the last thing that Lana mentioned in her presentation, which was the medical humanities versus the medical arts. Now, this seems to sort of be lumped together mainly in when people think about curriculum. So sometimes curriculum will talk about medical humanities, but it's a very different focus if you're looking at, I don't know, a more philosophical or a historical analysis of the arts compared to doing art observation, really, or creating, talking about narratives in general, or music making. So do you come up against this distinction much, or what are your thoughts to all three speakers about how you think of, well, medical humanities versus medical arts? And is a lot of these curriculums being outlined with just the humanities in mind without really making claims for the arts, but not really catering to the arts as much?
I'll start. I'm not. No, I don't make a distinction because I don't know the difference. So it sounds like I have something to learn about that. I do lump them, but interested in learning more.
Okay. Sujal, do you have any thoughts on that?
Yeah, could you repeat the end part of your question? I'm sorry, I had a bit of a freeze on my.
Oh, yes. I was thinking about when we've looked at some medical humanities. So a lot of the time when people, I thought this panel was amazing because all we talked about practice a lot and observation. And so there was some passive engagement aspects of it and active art making, but it wasn't really kind of a humanities focus as such, right? So, which I think is a strength for those sorts of curriculums, because the humanities focus can be much more focused on sort of historical or philosophical or much more literary interpretations of what the arts can do for us. And so we can see, like, in certain types of curriculums, those sorts of things are being catered to more than this sort of hands-on kind of arts practices, like the kind that Catherine is talking about, or that all of you mentioned. So I was wondering whether you've sort of examined differences in curriculum across different medical schools that do cater to the medical humanities in general, and what your thoughts are on the sort of more theoretical exposure to artistic practices in medicine compared to a more practice-based approach.
For sure. Yeah, thank you for repeating that. I think I had most of it, but was missing the end part. I think that's a great question because there is such a wide range of activities that we could consider in under this big umbrella. In my experience at Baylor, we have medical humanities courses that I think do touch on a little more of the humanities, but also include kind of the arts aspect. So we've had a lot of courses with like close reading of literature, for example, some of that being more historical or older, and then some of that being from like modern authors today. So having the chance to do some of that close reading and even looking at things like poetry. And then I've had another class kind of focused a little more on like a little more of like historical perspectives. And at the same time, I've also had classes looking at like kind of in the museum, like art observation and that sort of thing. I think they all have their strengths, and I think some of them can be more accessible for different people, kind of depending on their background, depending on what seems more approachable. If somebody has more of a background or interest in like the historical aspects, but feels very intimidated by like art making or music creation, I think that can be a really great starting point. I think there's so much to learn from, the history of medicine or literature about medicine, and some of which can lead to the similar types of conversations that might come from like an art observation activity, for example. So I think there's certainly merit to all of it. And it's important to kind of maybe keep your options broad, or at least introduce learners to different options within this larger umbrella, just so it doesn't feel too intimidating and folks know that there's a lot of different options here.
I might add as well to these great points that there's like a distinction as well between like medical humanities and health humanities, almost from medical humanities being more of within the medical school, like training of health professionals, and then health humanities almost from a more humanities department, like critical engagement from a more historical or literature and thinking about health and healthcare. And the two don't talk a ton, and it could be great to really integrate that with kind of the health humanities and medical humanities, medical students engaging with kind of health humanities, yeah, fields.
With that, yeah, that's great. And I think Erica, you asked me the question about do we communicate, collaborate with other, and I think there's a lot of room for that, just like you mentioned, collaborating with other parts of the university, the right hand and left hand. Um, I with arts, I said that we had exhibit, we had, crochet, we had performances, we also had short stories, we had poems that were submitted, and we posted them on a poster board. So we had that, and as part of some of the small group discussions during our curriculum, that sometimes that will be a poem as a prompt that we'll read, and then sometimes it's we've had a recently poem about end of life, and then use that as a prompt for discussion.
Yeah, that's great. Catherine Lan, if you have any questions, just unmute and just jump in. I'm kind of interested in the curriculum side of it as well, in terms of, is there much talk in the curriculums about medical humanities curriculums or medical arts or health humanities? And I'm curious about who you think does it better, Erica, the health humanities side or the medical humanities side. But and the way we think about curriculums in other fields is to think about what are the minimal components, what are the essential components everyone should be able to do, what would we count as an elective versus, a non-elect, a core. If you had to think about what should definitely be something that all students, medical students, should experience, even if it is, as Sujal pointed out in her talk, like you may not know the immediate value of it now, it might be only obvious to you, it may only, manifest later, why it's important to have been exposed to this particular practice. Do we have any understanding there about what is more foundational and what is less so when it comes to the application of the humanities and arts? In the medical context or the health context. So if you had to, if you had like, there's only 3 courses you can have, what 3 would we kind of prioritize for all of you? Any thoughts on that? Catherine, what do you think? You seem to be someone on the interface there.
One of the questions that I just came to my mind was, because I was just thinking how WashU deals with it and how UCLA was dealing with it for a bit, but one of the a couple of classes at WashU was medical anthropology, and I was wondering where medical anthropology fits in all this, and I didn't know if the other speakers had thoughts. And I feel like that might change my answer.
Does anyone have medical anthropology in their curriculum at Johns Hopkins or at Baylor? No. Can you tell us more about that, Catherine?
I feel like if I were to go, I think it's more medical humanities than medical arts. Because a lot of it is just looking at how it impacts populations. So like a course that I took was looking at people's experience in multiple different cultures of death and dying. So I feel like that is more humanities side of it. But I think part of your question was what is more foundational, and did you mean foundational for what specifically?
Well, I mean, to train the skills that we're looking for in medical health professionals. For you, I think for me, I don't have the data from what all of you have said. I would say the observation seems to be a really important skill to develop because that seems to have a lot of backing to it. But you might disagree and say, actually, it is the anthropology because those stories are very inspiring for people to learn about. And so it's more if you had to think about what your background has taught you about, oh, this is actually really way more useful than we might think it is, or that other things are great, but there were some things where that leave a large proportion of the students kind of cold and only engage some. So Erica, you unmuted, so I think you have something to say there.
Yeah, I might just I think I would try to argue for the incorporation of, as we've across these presentations kind of engaged patients as well into the art making process. And I think that's a pretty, if I were to want to see if there had to be a foundational thing, I would want to prioritize that. And unfortunately, it's not necessarily the standard kind of medical humanities course that's usually in the classroom more, but I think it's really important to be able to do it with the patients and have that maybe be your priority. So that would be like my hope or wish for what would be foundational, because you really then get that interactional component with the culture of the environment there. And then maybe a little bit more of the participatory arts involved as well.
Mhm.
You know, there's an
Yeah.
example. Sorry.
Oh, please.
Uh, just this noon, I was getting lunch at the medical school building and coming back over for the session. I was just across the street, but I saw one of my advisees who's on OBGYN rotation, and how's it going? And she said, "Oh, good. We just had a talk with, we had patients that talked to us, GYN oncology patients talk to us about their experience." So I guess it's an example where it's, something that into the curriculum, having patient perception, patient stories, talking to the students. And mentioned death and dying. After there's a memorial service after gross anatomy where the experience with the cadavers is memorialized, and students get a chance to write thank you notes to the families of the patients that donated their bodies.
Mhm. Thank you for sharing that. That kind of leads me maybe to my next question, which is all of you have touched on all of these wonderful tools that you've used directly in your own research and practice. And um, if you had to really put your finger on what is it that it's actually changing about, the before and after a student or a health practitioner is really exposed to it, is it a lot of the time from what you were saying, it was like it was suddenly exposing them to something that they were kind of used to doing or enjoy doing when they were younger, or it seems to be unleashing some kind of aesthetic sensibility there that is within us. And I wondered if you could speak to that in the medical side, perhaps, is it just that the training does not give space for that? So that's why these interventions are so useful and feel so meaningful, allows people to connect, because it's this part that stays a bit dormant usually, or is maybe unintentionally, but that its potential comes from this releasing something that's just it's not like teaching a new skill as much as it is opening up that's something that's quite dormant.
Yes, I would agree with that last part, kind of opening up something that's more dormant. At least in my experience, I found that a lot of medical students enter medical school with a lot of creative interests. So they might have pursued, singing or theater or art in college or prior. And then when it comes to medical school, they find that they don't have the time to pursue those activities in the same capacity, and that other students are also not really doing so. I think in college there are a lot more student groups centered around the arts. So, like, performing arts groups or visual art groups, music groups, than I think there are in medical school, just because of the time demands and like scheduling challenges. And so it might feel like not only do you feel like you don't have the time, but you're also not really seeing the community of people that might have those interests. And so a lot of folks, um, they might have that interest, but it just doesn't get prioritized. And I think these types of interventions can be really nice when they're kind of reminding people to return to something that they might have enjoyed, and hopefully that will be something that they then can pick up a little bit more once they realize how it might fit in.
That's great. Thank you.
Yeah, I'm sort of thinking that this Hopkins Evening of the Arts that we have, sort of giving students permission to get back to that or explore that part of their identity. And I feel like the students and are under so much pressure for building a resume to apply for a residency and what research projects they had, and try to some of them that I said, well, you published that, one of the students read a poem about orthopedics, and I said, you could publish that in Journal of Bone and Joint Surgery. I had no idea. And so she did. And so that is on her CV too. This poem, beautiful poem that she reflection. So I think the Hearts has sort of maybe opened up some permissions that students, oh yeah, this can also be used for your residency application. But I think a lot of, and then one of the students spoke at Hearts, said, this has given me the feeling that I can be a physician and an artist. I can be both.
Great. Thank you. Erica?
And speaking off to that last point, because I was thinking of agency. And so kind of that being able to see yourself, but also having that kind of creative agency, just agency in being able to I think have some kind of choice or control in a system that can often feel like it doesn't give you that. But not just from the student side, as well from when we can involve it with the community or with patients. I think there's that kind of agency on both sides that is created. And that's something that I've seen a lot, at least from the participatory music and in engaging in that kind of way. And I guess one question is I guess one question is almost like measurement and research, and maybe participatory research methods as well with it.
Yeah. That's fun. But that kind of brings me to my last question to all of you, in that, because you've talked a lot about students, so we haven't really talked about their mentors. And I mean, Richard, you serve as in that position here, and I think it's always, when we look at schools and so on, in the Torrance Center, we do a lot of work in schools, and a lot of the time we talk about the impact of the role model, in showing that of an example of a creative person in action. And I'm wondering if all of you could speak a little bit more to physicians who practice or professors of medicine, and whether, and Lana's work leads us to believe that there's way more, practicing artists of some sort in the medical profession. And I was just wondering whether you could speak to a little more about this role of the role model a little bit, that scientists should be, that medical professionals who engage in the arts should perhaps show themselves as examples a little more, or whether that serves as a huge, it just maybe doesn't give them agencies, to give them permission, or shows them that this is not a taboo thing, it's not a waste of time, or it won't disadvantage them in some way. Can you speak to that a little bit in terms of, do you think that that's something that medical students would, and health profession students in general would respond to more, to see more people like their mentors show it more?
If exactly, I would say it's a two-way street. I learn, I'm inspired by the students, their artistic creations and things. So I feel like maybe if we can help, give them permission, and then I'd be inspired and learn from that. I didn't mention some of the other things we've done in my small groups, team building, dance. I can do the apple dance now. So I think it's I think that, yeah, again, I think it's I think there's maybe kind of an example like what Sujal was talking about, of the students going into the with the intergenerational tell me about your story, and there's a two-way, there's give and take with the students and the patients in that environment. I think it's the same with students and mentors.
Thank you all so much. I think we're down to the hour. I think all of you, our panel in general, Erica, Richard, Sujal, you serve as role models to everyone in the field who's attempting to integrate the arts into the sciences, or just dare to be more multidisciplinary, or show all sides of their personality. Thank you all for this absolutely wonderful session of, I think, a very critical and growing area of interest. Thank you, Catherine and Lana, to join me as in moderating this panel. I really appreciate it. This brings us to the close of the Festival of Ideas. This has been a remarkable 2 days for us. For anyone who couldn't make it, or if you want to share the session with friends of yours, the recordings will be made available at the end of the day today on the festival website. I thank you all the participants here, all the audience here for listening in. And we hope you enjoyed it. Do let us know how we'll be sending around a sort of response letter for some feedback. But yes, thank you all so much for joining us for these 2 wonderful days on creativity and health and the power of creativity in any health context, including in the training of our future health professionals. Thank you so much, everyone. Have a wonderful rest of your day.